9. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 20.
Sorry, Chair, I'm just waiting confirmation from broadcasting.
Yeah.
That's us live now, Chair.
Okay, good morning everyone, and I declare the meeting open to the public and online, and I'd like to welcome all of our members who are participating by video conferencing today. Can I remind members about the protocols regarding the use of electronic devices? And members, due to time constraints, members, with your permission, we'll go straight to our briefing with the Minister and come back to other items then after we have had our present. Are members content with that? Yeah, thank you. Okay, members, so we're moving then to our COVID-19 disease response briefing from the Minister of Health. I refer you there, members, to your papers at tab 5 of the pack. I can advise members that the Minister is here this morning and the Chief Medical Officer to update the committee on the pandemic. So I'd now like to welcome by video link Mr. Robin Swann, Minister of Health. Good morning, Minister.
Morning, Chair.
And Dr. Michael McBride, Chief Medical Officer. Good morning, Dr. McBride.
Good morning, Chair. Good morning, members.
Yeah, thank you. So we're both seeing and hearing you both, so you're very welcome today again. And could I invite you then, Minister, go ahead and brief the committee, please.
Thank you very much, Chair. And look, I'll keep this short as per previous briefings to allow more time for questions and engagement. Chair, as we know, good progress is still being made. The number of people in hospital with COVID-19, although still high, and there is growth in case numbers slightly again. And we hope that severe pressure doesn't follow. Therefore, I must emphasise that if increasing social contact goes again too quickly, we may find ourselves back in the cycle that we've seen. But we know the rollout of the vaccination programme continues to make good progress and is expected to have a substantial impact on the epidemic in the medium to longer term. This week we have opened booking to priority group 7, and we expect this to be followed quickly by other priority groups with the aim of offering everyone in the JCVI priority groups 1 to 9, that's those aged 50 and over, a vaccination in April. That'll be a monumental step in a population-wide vaccination programme. We will then quickly proceed to those 18 to 49 in that age bracket. As the vaccination programme continues, its rollout is expected to be expanded to include community pharmacy stores across Northern Ireland, in addition to our GP practices and the regional vaccination centres. And as I've highlighted before, there is ongoing risk of increased transmissibility from new variants of the virus that have been identified elsewhere. And in addition, in the past week, cases of the South African variant have been confirmed in Northern Ireland and in Scotland and England. And cases of the Brazilian variant, as has been called or identified, have not been reported here. The full impact of the new variants will only be seen when measures are relaxed and their number may rise more than would previously have been the case. Chair, I welcome the publication of the Pathway to Recovery document by the Executive to provide assurance for all of us that there are plans for the economy and for society to reopen when it is safe to do so. However, it is critical that we do not respond to the success of the vaccination programme and the announcement of the recovery plans by letting our guards down, because now is not yet the time to do that. We don't want to see more cycles of relaxations or lockdown again, with all the harm that actually brings. We must take those small steps and watch the consequences to avoid the return to epidemic growth of the virus. As the pressures from this wave begin to reduce, I'm turning my mind yet again to the rebuilding of our services. I made it clear to officials that I expect to see action to repair some of the damage and the delays that this virus has inflicted. And I'm aware that the committee is to get a full update next week. But needless to say, the waiting list position in Northern Ireland is not good, and we know that. I've agreed that the health and social care system should follow some of the key principles as we de-escalate ICU and rebuild elective care services. These principles include the need to de-escalate as a region, and that the Nightingale facility at Belfast City Hospital is prioritised for de-escalation. That's because Belfast City Hospital normally hosts our complex, high-priority surgery on behalf of the region. So I'm keen that we scale up this high-priority surgery as quickly as possible. And this can be achieved by initially creating green pathways as they become known elsewhere on the site, and eventually turning the Belfast City Hospital in itself into a green site which will serve the region. And that will be facilitated by delivering critical care for COVID-19 patients at the Mater Hospital once again. Elective care rebuild must reflect a regional prioritisation to ensure that those most in clinical need, regardless of place of residence, are prioritised. And at the same time, all trusts should seek to develop green pathways and begin to schedule theatre lists 2 to 3 weeks in advance. That aim will be for allow us for any given staffing availability to actually maximise theatre throughput. I've also asked our trust to proceed with developing ambitious rebuild plans on the basis of these 3 principles to cover the period. The initial period will be from April to June, and I intend to publish these, Chair. I'll publish these in due course. So I'm now happy to take questions or comments from members.
Okay, thank you, Minister, and I do want to acknowledge the continued benefit that the rollout of the vaccination programme is bringing. I think that's certainly something that does provide some cause for hope, but as you say, not cause for complacency. So listen, and I know you have given us some detail there, but in relation to the red flag cancer surgeries, where are those at present in terms of where each trust are in relation to completing those red flag and other life-threatening conditions? Sorry, I'm not hearing you there, Minister. I'm not sure. Clerk, can you hear the Minister?
Apologies, Chair.
We lost you there, Minister.
Apologies.
Okay.
No, Chair, as you're aware, we've now looked at that as a regional approach, that first step in rebuilding those specific surgeries. So we are seeing surgeons, we're seeing teams willing to travel, we're seeing patients now willing to travel as well. Between the 1st of January and the end of February, we had 1,076 surgeries either will actually cancelled. To date, 86.2% of those have been rescheduled or completed. So there's 149 of those are still being worked on to get them into the theatre slots that we have developed and are developing as well. So that level of those still waiting is continually decreasing over the past number of weeks as well, Chair. So it's a piece of work that is ongoing. As I say, we've re-established that, or we have established that regional board where there is a prioritisation now of patients at a regional level rather than solely at a trust level at this stage.
Okay, and is there a particular difficulty or do you have concerns around paediatric surgeries? Is that something that is particularly concerning, or do you have anything in terms of update on that?
We did. We met with, I actually met with the paediatric surgeons just over a week ago, Chair, in regards to access facilities as well. And we are maybe looking at trying to get a regional centre established specifically for those I suppose those high level paediatric surgeries that we may need to take forward. So again, it's about why we move through these rebuilding plans, opening accessibility to footprint provision that we already have to those teams, Chair, that are keen to get back and working on their specialities and the lists that are there.
Okay, thank you. Minister, I know that around recently there have been some difficulties around the vaccination programme in relation to the rollout to carers, and it's very welcome that carers were identified, that very important cohort were identified. Would you agree that the lack of detailed information on where carers are and who they are within each trust, that register has been part of the issue in relation to that? And is that something that's being looked at in terms of how because obviously if we can't identify those people, it's more difficult to signpost or get support to them. So in response to that becoming obviously raising its head as an issue, have you done anything to try to ensure that trusts have an accurate register of who is a carer within their area?
But Chair, I think you've had one of the difficulties bang on nail on head, shall we say, and is that the fact that not just in health in Northern Ireland we don't have a central carers register. So should it be carers that are connected with ourselves, carers that are connected through Department of Education as well? There is no central database. So when we started down the road of allowing carers to access the vaccination programme, Tradition told me we actually had a very detailed and engaging sessions with all our care representation organisations, which maybe aren't even identifiable or notifiable to trusts as well. So that's why we took that approach at the start. But the work about establishing that central carers register is something that we're keen to progress when we have the time and the space to do it, Chair, because it is vital in supporting those people who need that support to provide the care that they are doing. So it's a piece of work that will be undertaken if I can get the time and space to get to it. But it has to be one that is cross-departmental as well, Chair, because carers just aren't solely based in health and within health trusts. So we need to get that central database so we can make sure we can support everyone.
Yeah, and I do recognise that time and pressure are always factors, but I suppose my particular concern is that those carers, because a lot of the COVID response impacted directly on those carers, the services closed, and a lot more of the care and responsibility, which was already quite onerous, went on to them. So I would urge you to sort of prioritise that. And just in terms of a quick update, then you have said you're looking at potentially a one-off payment for carers. Can you give us any update in terms of COVID in recognition of the COVID burden? Can you give us any update on that today?
And again, Chair, it is proving difficult, and it's proving difficult for the exact reason you've raised is the identification of carers. So I have a paper produced in regards to that because it is so cross-cutting. There is a paper that I have prepared ready to go to the executive in regards to that, because the further we get into it and the groups that we try to identify or process payments to, it's not simply either within the legal locus or the ability for us to have payment mechanisms. Whereas there may be other departments that have easier payment mechanisms that we can do that. We have set aside a sum of money to enable us to do that. So it will be looking to support from the rest of my executive colleagues in regards to actually processing those payments as to where they go. But Chair, I think you'll know as well as I do that support is there, I think, across the executive. But it's how we actually process that and identify the people that are and should receive it. Okay,
and then finally from me, Minister, before I go to members, then a number of us last night did a meeting with Fairness and Fertility and with members of the public from across the north who are affected by the postponement of IVF services, and I know that's a difficult issue along with many others. However, one of the issues raised in that meeting was that people who are on a list or who may because their service was postponed due to COVID, that no one who's procedure was postponed due to COVID would be penalised on the basis of time. Could you commit that that would be the case, that no one would fall out the system as a result of something that was beyond their or anyone's control?
I think that's the commitment that we actually did make during the first lockdown, Chair, when those services were reduced, and we actually even increased age range capacity as well, because that had been a restricting factor in the past as well. So no, look, Chair, we're keen to work with anyone to make sure that if they were on the list or if they'd started treatment, to make sure that they progressed through the treatment that was stalled due to COVID and due to us having to step down services for that period of time.
And do you have a date now for the resumption of those services?
I think the Belfast Trust is due to start those shortly, Chair, if they haven't already commenced them on small scale. It is something that I prioritised or asked to be prioritised during the first wave. So it is something that is known within the Trust that it's something that I want to see started. Michael, do you have a specific?
Yes, just to say you're correct, Minister, that it has restarted, although with particular cases in terms of those individuals, for instance, in relation to sort of some of the more complex cases, that has restarted at a small scale, and I think the Trust is committed to increasing the service provision as soon as is practically possible, which is obviously, as Minister said, something that we all wish to see.
Okay, thank you. Okay, thank you, Minister and the Chief Medical Officer. I'm going to go then to members for a question. So I'm going to, at this point in time, I have indications from Ciara, Jonathan, Jerry and Paula. So I'll go to you first then. Ciara, go ahead, please.
Thank you, Chair, and I'd like to thank the Minister and Michael for being here again today. I have a few questions. One of them is around stock and supply of the vaccine. I know earlier this year, Patricia had said there was a number of difficulties at the start with shortages. I'm just wondering, as we veer into coming up to the point where we're about to vaccinate the general population later in the year, do you foresee any issues with stock and supply, and what assurances can you give the public that it won't be an issue? Thank you.
Thanks, Karen. I think that's always something we've been very conscious of when we talked about next steps in our vaccine programme. We are dependent on supply chain, and we get an indication, our usual indication leads up to maybe 2.5 months in advance as to what we're indicated to get. So that's always what we plan for as well. So those reassurances are very much based on the surety of supply that we get. What we've seen is what we're being told we're going to get. We usually do there or thereabouts. The additional challenges that we see now, which we have to factor into the programme, although we're moving into other cohorts, we are also moving now into the phase where people will be entitled to their second vaccination. So the ones as well. So it's about how we manage both vaccine supply, but also our vaccine programme, facilities, staff as well, and the entire logistical programme around that to make sure that we're still bringing people forward from the first vaccination, but also that people have the vaccine and the ability to get their second vaccination slot as well. But that's all. And I know you've had regular updates from Patricia, and you'll know that detail is there in regards to what she has planned out. But we always look to that 2.5 month projected cycle to make our plans as well. We don't call people forward unless we are sure that there will be vaccine supplies for those cohorts.
Thank you, Minister. My next question refers to COVID passports. We've seen over the past number of weeks it's been an issue within the news, and a few constituents have reached out seeking clarity on the matter. So I'm just curious if you foresee COVID passports within Northern Ireland, for example, for access to services or to travel. If you have any updates on that or any concerns.
Thanks, Cara. And it's one of those very topical conversations at this minute in time. There was a Four Nations call last night at First Minister's level, which I was part of, and I know it's a piece of work that Her Majesty's government are actually undertaking as to what that looks like. It will bring particular challenges, especially for us, because if we introduce a COVID certificate or passport or whatever it may deem to be about access to services, especially, it's how we match that as well, and that's something the Deputy First Minister raised about how that's concurrent across these islands. not just throughout the United Kingdom as well. So I suppose the additional challenges, as well as how they're perceived on an international basis. If some countries insist on having a vaccination certificate or passport prior to entry for holidays and things like that, it is something that we will have to develop to allow that greater part of travel. It's not something, and I'll be honest, it's not something from a political point of view, a personal point of view, that I think we should ever develop in Northern Ireland, that we would need to provide certification of vaccination to enter a cinema or to enter a restaurant. That's not something that sits comfortably with me. In regards to proof of international travel, we already have those, in certain regions for yellow fever certification, for vaccinations, things like that as well. So it may become an international requirement of that proof, but to access services would be something that I think, I don't think the executive or I don't think the Assembly would be entirely comfortable with.
Okay, that's a good answer. Thank you, Minister. My next question refers to a change in service provision. I was looking over our table of papers there on point 8.25. It was regarding addiction inpatient services, which have been temporarily stood down within the Northern Trust. I'm just wondering if you have any clarification around why this is and when we foresee it, being restored fully. I'm just mindful, I was looking through the notes, and under active outbreaks, the Northern Trust wasn't mentioned. So I'm just curious, just to clarify why these have been temporarily stood down, and is it due to staff redeployment?
Cara, and I think you actually answered. So unfortunately, you answered your own question. Yes, it is due to just staff redeployment as well, because and any of our delivery services that we've had to stand down, they are taken in regards as to what staff we need to redeploy, where they can be redeployed from. But one of the things, and I think in my opening statements as well, when we look to those rebuilding services, and again in the fertility services that the Chair mentioned, it's about how quickly we can get those services stood back up again, because we do know they're there for a reason, they're there for a cause, and it's about getting them back there to support and serve the people that actually need them.
Thank you, Minister. And just on that, do you foresee, is there a time scale, or has there been anything identified of when these crucial services will be restored?
I don't, Cara, to date have that detail for the Northern Trust services as well, but certainly if it's not in your briefing or not answered later on, if the clerk gets in contact with the department, we'll get you the update for that.
Thank you, Minister. And then just one more question, just around gym closures. We know that I'm sure other MLAs share that we've had a lot of people, asking questions around the gyms. That creates a sense of community for people. Yesterday at the dual diagnosis APG, a man called Gary from Derry and Arc Fitness had talked about, the use of gyms to help people recover from drug and alcohol dependency, the sense of community and the sense of hope and support that creates. And I know with the pathway being announced earlier this week, I'm just wondering if you could give us, any updates on how the decisions around gyms reopening will take place.
Well, Cara, I think that'll be taken in the round, when we look at any relaxation or any step that we take as an executive in regards to, the relaxations that come at specific times as well, and where the priority is and the overall balance and the assessments that are made with each step. I think one thing we have to be conscious of is that each small bit that you open, no matter where, no matter what it is, has a cumulative impact. So where we all may think, a certain activity only has a small impact. If there's another certain activity has another small impact, when you look at the overall cumulative effect that all those small steps have, they do have an effect on what we're trying to do. So it's why the executive takes that, I suppose, proportionate response to where we see the different measures and take those steps at the right time as well. So we understand, and the Chief Medical Officer has been on record in regards to the benefit of physical activity as well, both from not just physical well-being but also mental well-being as well.
Thank you. Okay, thank you, Cara. And just to indicate to members that we are a little bit tighter for the Minister's time this morning, so I appreciate everyone, both questions and answers being succinct as possible, as they have been today. So thank you for that. So I'm going now to Jonathan.
Thank you, Chair. Can you hear me? Yes?
Yes, we hear you okay, Joe.
Thank you, Minister, and thank you, Michael, for coming to the committee this morning. Again, I fully appreciate the difficult job that you are involved with at the moment. It's certainly not easy, and our vote of thanks for everything that is happening within the health service. I suppose probably I do want to talk about the pathway to recovery. I, like many others across the country, looked upon the document with a lot of frustration with a lack of clarity, etc. for a reopening, and also a frustration at the lack of involvement that the committee had in prior to the release of the document and talking about it and looking at a potential way forward, given that our central role throughout this pandemic. And I suppose probably, and it's maybe a question for Michael at this stage, but I understand there's been significant forecasting and data approach is what we've been told that the document is, and significant forecasting has been carried out right throughout COVID-19 in terms of monitoring pressure on our hospitals, etc. Could you maybe elaborate where that data comes from to begin with? And if it is a case that this document is data focused and not date driven, why couldn't we then use the data to provide indicative dates to give people a sense of direction in terms of timescales that they can prepare for a potential reopening if the data is consistent with your forecasting?
Maybe just, Chair, if I could come in regards to the document itself, because I do notice Johnny's comments in regards to the committee not being involved. It wouldn't be up to us to involve the committee in an executive document pre-release. Johnny, this is an executive pathway. It's not solely a Department of Health document. In fact, we were presented with it so we could give our input into it as well. So look, in regards to your comments about the frustration, we want to be honest and upfront with people. While there is the hope of better days ahead, putting in dates now for possible relaxations weeks away could not be done with confidence or certainty. And as an executive, we understand the businesses need time to prepare to reopen. So we'll continue to engage with all the sectors and work in partnerships for a safe reopening when the time is right. Each relaxation will need to be informed by the impact of the last on community transmission and the RT number. And the executive's committed to a 4-week review cycle where we will monitor the data on a range of health and societal impact before considering what relaxations can be made safely. So while acknowledging that, Johnny, that's the opening paragraph from one of the documents co-signed by the First and Deputy First Minister in regards to how this document was constructed, how it's set out as to the approach it takes and in regards to the approach that was agreed by the executive. In regards to the data, and again included in the document as well, as it actually says, we will continue to monitor a broad range of data, information and statistical indicators to inform our decisions on whether to relax restrictions or whether we need to return to strengthen them. Health trends that we will look at, as we've always looked at, will be based on World Health Organization conditions for adjusting restrictions. Those include maintaining the RT number, health service capacity for COVID and non-COVID, test, trace and protect, population immunity, which now includes benefits from our vaccine programme, and the emergence of new variants. It also states that economic data and indicators are critical to ensuring that decisions will have the best impact on starting the road to economic recovery as well, and they're listed. So I know the frustration that you're expressing, but I do need to be clear that the pathway document is one from the executive, and that's why I thought it was important just to make sure.
Minister, I understand that it's an executive document, and I have read it, by the way. So I'm just saying that I wanted to know, given forecasting, which we are told throughout COVID-19 has informed decision making regarding, I think it was talked about at the time in the run up to Christmas, that there was a forecasting of the pressures on our hospitals and how that would then lead to restrictions being needed to be put in place. Given that forecasting, why can't we use forecasting to give indicative dates for if the data stayed as it were and the forecasting model was accurate? Maybe Michael could answer that question, that we could then give some form of clarity to industry as to the forecasting models in line with a potential date for reopening?
Michael, do you want to come in?
Yes, thank you for the question. We've never done forecasting. We've never made predictions. What we've been relying on throughout the course of the pandemic is actually modelling on the very criteria and metrics that the Minister has just outlined. The number of cases, the pressures on our health service, and on the basis of that, modelling. And modelling is not forecasting, and it most certainly is not predictions. Ministers indicated, and certainly the document is, I think we need to bear in mind, a public-facing document. And on page 27, as you're aware, it does, as the Ministers outlined, clearly articulate those measures that will provide us with an assessment as we walk our way back out of restrictions, the answer to several important questions. The first important question is, do we have the epidemic still under control? Yes or no? And there are certain measures, and the number of cases is one of those. The number of positive cases, the percentage of positive tests is another. Is that under control? And we now know and are used to those sorts of numbers, so the R number is really important. If it gets above 1, the epidemic is growing. We don't have it under control. If we keep the percentage of positive tests well below 5% and consistently below at 5%, then we know, and that's the WHO criteria again that the Minister has alluded to, then we have the epidemic under control. Is our hospital, and that's just some of the questions that we may be looking at, some of the data streams that we'll be looking to inform decisions about whether the epidemic is under control. How many cases are related to background community transmission from our surveillance systems? We would like to see a low level of those, and any cases we do see related to clusters and outbreaks, and that with our contact tracing system, that we're identifying all of those contacts. So those are the clear measures and metrics which will identify whether we're getting and have the epidemic under control. Similarly then, are we able to continue to provide healthcare, as we've been discussing earlier, for non-COVID and for any surge in COVID cases? But as I say, those WHO criteria that the Ministers alluded to are in the public domain and are accessible.
Okay, and finally, I suppose, because I think we have explained a lot there on that. So given then, can somebody confirm the exact stage that we are at present, okay? And then given the review dates...
Very briefly, Jonathan, please.
13th of May. Those review dates, if the data stays consistent with what is being presented at the moment, will those review dates lead to moving to the next stage, date by date, given what's in the pathway to recovery?
Brief answer, please.
So our modelling wouldn't be, we've never been able to go that far in advance, Johnny, for what we have, and that's why we put in those specific review dates, because one thing we have been clear about is by each step that we do take, we take time to actually assess what impact it has had before we go to the next phase as well. So while those 4 dates are there as specific review dates to regulation, I would be cautious, and I would caution people not to see them as the exact date where we move to each stage, because I think what the First Minister and Deputy First Minister have both indicated as well, that there may be opportunities where we can move down one of those 9 pathways actually quicker, should the indicators take us in that direction, or there may be some that move slower, and that's the approach we took in coming out of the first lockdown phase as well. So we took those steps that were proposed at that time, and that worked for us. That's why we got into such a good position here in Northern Ireland during last summer.
Thank you.
Okay, and thank you. So, going across then to, well, first of all, just to let members know at this stage, I have Jerry, Carol, then Paula, Pam, Carol, and Arlea indicating in that order. So, go ahead, Jerry, please.
Thanks, Chair. Thanks, Minister TMO. Minister, we've obviously talked a lot about mental health in the previous times you've been up with the committee, but I want to hone in on some particular aspects of it. Just 2 weeks ago, the 123 GP campaign released figures showing a lack of in-house counselling services and GPs. Some 50% of GPs in my own constituency, West Belfast, don't have any in-house counselling services, and we have a high problem with health issues in our community, and it's very, very worrying and set to increase with the aftermath of the pandemic, whenever that is. So a couple of questions pertaining to that, Minister. What assurances could you and your department give that nobody will be forced to wait more than 28 days before they get access to a counsellor? My understanding is there's no targets at the minute to increase in-house counselling. There's no measurement of waiting times in GP services. And my understanding is that is not the GP in-house service is not mentioned in the mental health draft strategy. So just a few response to those questions, Minister, and I'll follow up with any replies.
Thanks, Jerry. Look, in regards to the GP in-house services, those are services that GPs can bid for to have access to in their surgeries and their provision as well. So again, because they're GP surgery based, it would be up to GP surgery to approach to seek that support or that provision, the same as the multidisciplinary team support and provision as well. So there is steps that we take to do that and support it as well. So it is work that is ongoing, and I think where necessary, people with mental health are referred by their GP to secondary care mental health services, and each across of the 5 trusts. The same with independent contractors, GPs have the choice to provide the services for their patients. Our Health and Social Care Board is met regularly with GP representatives, actually to encourage GP practices to contract for services where uptake is lower than some of the other areas. So that would actually support fill those gaps. And as I said, in regards to the multidisciplinary teams, we have those running, and again, unfortunately, under transformation funding as well. So that, the more surety I could have in funding, the more multidisciplinary teams we could actually open out there as well. I'll take up your point that they're not mentioned in multidisciplinary or mental health strategy. Not something that had come to my notice to date, Jerry, but certainly something I'll follow up on.
Thanks, Minister. I appreciate that. And with respect, I think the reply or the answer that there's money there and they can apply for it isn't really addressing the fact that there's such a discrepancy. Some areas across the north, some constituencies, 100% of GPs, I think it's East Antrim, have these services, and that's great for people, obviously, in East Antrim. But in West Belfast and other parts of the north, there's not a high uptake in them. So that's very concerning, and work needs to be done to address that. Also, I think there's a discrepancy in the amount of money being spent on these services. It's several million. I think it's around about 3 million from the HSC board. There's around 10 million per year per annum spent on drugs for treatment of mental health, and obviously that's important for some people and some conditions, but there's a concern that there's an over reliance on medication rather than counselling services. But I'll just move on, so time is quick. Minister, last week, Charlotte McCardle, the Chief Nursing Officer, said only 1/3 of care homes were operating the care partner scheme that you obviously announced last year. Why is it that a vast majority of care homes are not acting on your agreement? What action is being considered or being taken to ensure that private care homes not only abide by your direction and guidance, but also make sure that loved ones can access to their families who are in care homes at this very difficult time? And have you considered fines or financial penalties in that consideration? Thank you.
Yeah, thanks, Jerry. And again, a point that I feel strongly about is about when those changes of prison regulations are made, that the care homes do move to facilitate them as from the 1st of this month, as from Monday, because of the change of the alert status due to COVID. We moved from level 5 to level 4, which does change visiting guidance and regulation as well as to what has been done. I met with Charlotte and a number of our chief officials last night actually in regards to care home visiting. I was speaking to the Commissioner for Older People as well because he was rightly raising his concerns in this area as well. So we do continue to engage with care home providers to see what their difficulties are, because again, we have the guidance is there, the regulation is there, but also the funding and support mechanisms are there as well to facilitate more visiting as well. We identify care partners as those being able to access the vaccine to facilitate that as well, because it was a concern that some care home owners actually raised with us that they were, residents have been vaccinated, staff have been vaccinated, but they didn't want to, they were concerned about them letting in care partners. So we covered those under the carers protocol as well. I think that there's over a region of, I think it's over approaching 1,200 people have taken up the vaccine as care partners as well. The latest count, I think Charlotte indicated last night, was actually in the region of 48% of care homes were now implementing care home status. One of the concerns that we would have, and one of the things that openly raised with me that I want to see addressed, was that's a self-reporting mechanism. So we've asked RQIA if there's more they could be doing to ensure that those who are saying they are delivering care partner facilities, that they actually are, but to those who aren't, that we do look to see what can be done as well, because of, I think we've been clear before, and I think openly maybe even in the region as well, if there is legal action needs to be taken, it's unfortunate that anybody would have to go that length. But as we move through all the support mechanisms that are there, but also the change in visiting status as well, that should encourage more care homes to do that. And Chair, just as an aside, and not to take away, I think one of the things that we should note as well, through our vaccination programme, on the 11th of January, we were supporting 150 care homes which had an outbreak. Yesterday it was 23. So we can see a direct correlation to the success of our vaccination programme, and especially taking that approach in care homes as the initial cohort that we actually indicated and followed up on.
Yeah, I think that's certainly welcome and encouraging. I had noticed that was a significant drop there, and I'm sure we're all relieved about that. So listen, I'm going to Paula then. Paula, go ahead, please.
Good morning, Minister and Chief Medical Officer. My first question is in relation to the special educational needs teachers. Minister, I haven't, as you know, have not at any stage during this vaccination programme tried to prioritise one profession over the other, and I do believe in the clinical vulnerability and at-risk criteria around that. However, there seems to be delays in terms of the rapid testing in SEN schools, and also there's a high number of SEN teachers who are actually off sick. Marry that then with their parents, the parents of these children, their carers who've been living on their nerves for a year, and then the very rigid test, PHA, through the community paediatrics are introducing as to which SEN teachers are being vaccinated. Is there no way that you can intervene, Minister, and try to have a blanket approach to SEN teachers, please? Thank you.
Thanks, Paula. And in regards to there's I suppose the dual approach there in regards to vaccination and also testing as well. Paula, there's not. I have maintained JCVI status and guidance from the beginning as an approach that has been taken across the 4 nations. Like you, there's many individuals and many cohorts you could make a special argument for. But there are so many you can make that special argument for. It starts to prove then difficult to actually provide a vaccination programme that we can. One of the latest updates that came from JCBI was in regards to, and they had been looking at it, but the prioritisation of occupation. One of their findings, one of their pieces of guidance is that if you start to prioritise specific work cohorts at this stage, it could actually end up slowing down the vaccination programme, because we're now looking at the mass supply and the mass accessibility of vaccines. So it's better in their guidance that we move quickly through cohorts by age profile, which will hopefully catch up all those interest groups and all those special groups that need support as well. In regards to the specific testing, Michael, do you want to come in there, because we are making stages in regards to testing, not just in special schools, but also in other schools as well.
Yes, Minister, thank you, and thank you, Paul, for the question. A very important area, as you've quite rightly identified. As the Minister has indicated, we have certainly worked very closely, Public Health Agency, with the Educational Authority, with the Department of Education, and with local paediatricians to identify those children with particularly complex needs who would benefit from those working with them having the vaccine. And it's all about protecting vulnerable children, as you've indicated. That work has been completed. There's a communication, I understand, that will be shortly going out to special schools. I want to thank everyone who's been involved in that, and I hope that that vaccination programme will get underway in the very near future. In terms of the testing, that again has been agreed. The rollout of that is commencing, is my understanding, or has commenced within 5 schools at present, with a view to rapidly rolling out to the other 39 remaining schools. It's obviously a complex process for both parents, children, and indeed staff. As I say, that will be facilitated through lab tests, which are saliva-based tests, so it's less invasive for the children. And I'm grateful to Queen's University, who'll be working very closely with PHA and EA in terms of facilitating those test results and getting them to the teachers themselves and also to pupils, parents. So that work is well underway, Paula, and is progressing.
Thank you. The second question is in relation to post-viral conditions, obviously long COVID being one of them, but another being ME. And Minister, you will recall from your former colleague Joanne Dobson how long she was campaigning for a medical clinical lead in this regard for the 7,000 ME patients in Northern Ireland. That has obviously collapsed in terms of how the Health and Social Care Board has taken that forward. And there's the potential that ME could be brought in with long COVID in terms of assessment and diagnostics. There is a concern amongst those 7,000 patients, Minister, that they will actually be sidelined, and they're feeling very aggrieved that after, is it maybe nearly 9 years since Dr. Henry moved out of that post, that they have not had a dedicated service. And I'm just wondering how you're going, now that there's more of an attention and a focus on post-viral conditions, how you're going to support the 7,000 patients here in Northern Ireland. Thank you.
Thank you, Paul, and I think for the recognition, it was one of those campaigns that Joanne was very passionate about, led on very strongly as well, and remembered as well. In regards to, I suppose, the support of those 7,000 people that do need that additional support in regards to the additional provisions that we're looking to put in place in regards to long COVID as well. As we're looking to see where there is the crossover of supports that may be beneficial to both cohorts as well. But in specific in regards to the ME provision, while it has been a difficulty, I think, as you say, it's been 9 years since that post actually has been filled in. It's a piece of work that is still being looked at. Unfortunately, I don't have a positive update or any update that I can give you at the minute. It's not something I was prepared for, but I'll get back to you if you're content with that. Chair, if that's okay, I'll give an update to the committee in answer to that specific question.
Can I just, one very quick question, or maybe just to put on your radar, Minister, and it's off the back of what Colin was talking there about the Regional Fertility Centre. Accompanied and associated with that is the fact that my understanding is that the endometriosis consultant left his post a year ago and hasn't been filled. Some of the women on the call last night and constituents I've dealt with are in a really, really bad way with endometriosis. Their surgery was delayed a year ago, and now when they've gone back, they've realised that they have organs that are fused with these adhesions, and the surgery and other treatment is incredibly invasive now, if not impossible. Can you please look into this gap in a consultant in endometriosis, because it is so important that we get that post filled? Thank you.
No, Paul, again, thanks for flagging it. Michael, is there anything specific you have there on that poster?
No, nothing I can add, Minister, although I do appreciate all of the pain and distress by often a very debilitating condition, which is there's often a significant delay in the diagnosis in the first instance, given the nature of the presentation and the symptomatology, and have very profound implications in terms of the long-term sequelae of that, as you've indicated, both in terms of fertility, pain, etc., and requires a very complex multidisciplinary approach, both surgical and support. So very happy to get back to you on the detail of how that's been progressed.
Thank you very much.
Thank you, Paula. And going then to our Deputy Chair, Pam Cameron. Pam, go ahead, please.
Thanks, Chair, and thank you, Minister and Chief Medical Officer, for your attendance at committee today. I wanted to kick off with just something that the Deputy First Minister mentioned yesterday in the statement to the House around the pathway to move out of these restrictions. And she referred to here being much, much worse, that's not a direct quote, than everywhere else. I think she meant in the UK and possibly Republic of Ireland. So could you give us an update of the infection rates and the comparisons with each part of the UK and also the Republic of Ireland? That's my first question. Thank you.
Okay. Thanks, Paul. I don't have slides to date. Michael, do you have the updated slide that we presented yesterday in regards to infection rate? I do know, I don't have exact figures, but I do know that we were somewhere at level with Scotland. We were lower than the Republic of Ireland and England, but higher than Wales. Just off the top of my head, I'll ask the Chief Medical Officer. Maybe if you're not.
Yes, I don't have the exact slide details in front of me, but as you will, as you recall, that what we've been saying over the last couple of weeks, that the relative test positivity rate, if we look at the 7-day cumulative total cases per 100,000 as published by the respective countries over the last number of weeks, that has changed, and the differences between the 5 nations has narrowed. So at various time points, we went back a significant number of weeks. We had the Republic of Ireland was at a very high level compared to the rest of the United Kingdom. As a result of the measures taken there, that fell very rapidly. And over the last few weeks, Northern Ireland was seen at a significantly higher level than Scotland and Wales. That gap has narrowed in the last week. And the data that I shared yesterday publicly as published information demonstrates that the gap between Northern Ireland and Scotland has narrowed. The prevalence is higher in is higher here than in Scotland and higher than in Wales. Is now below the Republic of Ireland and again below England. But as I say, that is a very a fluid position, and if I look back at the figures last week, it would have been different again. There are other ways of obviously estimating that, and one of the other important studies is the Office of National Statistics Infection Survey, which demonstrates that, just to summarise it in the interest of time, that about 1 in 104 people in England have been estimated as been infected with COVID. 1 in 195 in Northern Ireland. 1 in 225 in Wales, so again lower, and 1 in 205 in Scotland, lower again. So we do, at least on the looking at those 2 different measures, the estimated prevalence here is higher than it is in Scotland and Wales, confirming the published data in terms of those testing positive, and at present is lower than England.
Can I just come in there? Sorry, there's a bit of background noise bleeding into the conversation. Can I just ask everyone who's not speaking to ensure that they're on mute, please? Okay, and I'll go back to Pam then.
So for clarity there, and thank you for that detail. So for clarity, do you agree with the Deputy First Minister's assessment yesterday that the infection rates are much, much worse here than the rest of the UK and Republic of Ireland?
I didn't hear the Deputy First Minister's comments yesterday, and I didn't hear the context of what you said, or was it in a statement or a response to a question? So, again, I don't want to be drawn into commenting on that, in that I, as I say, don't know the context, and I didn't hear what was actually said.
And it's not a description of our infection rates that I would use.
Thank you. Okay. Moving on to vaccination, and I do very much welcome that the move to over 50s will be vaccinated come April. And I also understand the calls from other professions, such as police in particular, given what they face in dealing with placing restrictions, for instance, and also for that the call for priority for teachers. I understand that. I don't necessarily agree with prioritisation in terms of professions myself either. But I think the ultimate solution to this is still to get everybody vaccinated as quickly as humanly possible. And that leads me back to my previous calls for a 24/7 rollout, and understand supplies will be coming. There should be hopefully there should be much more supply coming very soon. And would you consider, Minister, a rollout, or even piloting, even at small section time, even a week or a weekend, a trial even of 24/7 rollout, to see how that would, if those slots, if people would actually be willing to come in overnight and in the early hours in the morning to actually have their vaccination done, because I honestly believe that people are desperate to move on in time and to get past these restrictions, and actually the vaccine is the biggest way out of this, or the most helpful way out of the restrictions. And I think really we need to pull out all the stops and ensure that the vaccine is offered to as many people as possible, and understand that is dependent on supply. But if you have supplies, are you prepared to roll it out 24/7?
Pam, I think what we're again dependent on supplies. I think our next step is to making it as accessible as possible, and that's why we're moving to what has been scaled our mass vaccination centre, which is going to open at the SSE Arena, where we hope to be able to do 40,000 people per week. That will still be running alongside our 6 other regional facilities. That'll still be running alongside our GP practices, and then towards the end of this year also community pharmacy as well, once we get that bottomed out as to how many of them will be able to do it, where they want to do it, or where they want to centralise some function as well. So I think rather than looking at time, it's about location, to get vaccination as close to people as to where they are as well. In regards to the SSE Arena, we are looking to extended hours. We're not talking about 24/7, but it's something definitely when we see uptake, when we see bookings there as well, and how that's progressing based against supply. It's something we look at, but as for going 24/7, I don't think we're there, but maybe running later into the night rather than just, running from or 8 to 9 or 8 to 8 that we're doing now. It's something that we'll keep on the table at all times, because like you, I want to get as many people vaccinated as quickly as possible.
Thank you. Okay, thank you, Minister. And going then to Carol. Go ahead, Carol, please.
Good morning, Dr. McBride. How are you? So my questions are relating to workforce planning. So we had the CNO and the Deputy CNO in front of the committee last week. I just want to say to you, I found it a bit shocking that there's almost a relaxed position in terms of the safe staff legislation not coming through. And I am concerned regarding the horrendous year that our health and social care staff have been through, that we need to see, in my opinion, an intervention to look after them a bit more with legislation. The other question I have is in relation to the red flag surgeries. So in Belfast pre-COVID, you were looking at approximately 900 surgeries a week. At the minute, I think it's been stepped up to maybe around 200, which is welcome. So given the fact that Belfast City Hospital will become a regional centre, what is the average a week? And the other aspect is, you said that COVID patients will be moved to the Mater. Does that include ICU facilities? I think we need clarification on that. The last thing I want to say is I would appreciate some feedback to the rest of the committee regarding the workforce planning issue. It's been with us for some time, but particularly now, we've all paid tribute to our health and social care staff, and we're all sincere in that. But I think we need to step in, frankly, and look after them a bit better than what we are. And I think the absence of safe legislation is quite disappointing, to put it mildly.
Thanks, Carl. In regards to supporting our staff, I don't think you'll find a stronger advocate than myself since we came in to this position. You know, our staff were on strike when I came into this post, and it was on pay regards and it was on safe staffing as well. There has been a bill team established to bring about that legislation, and it's now engaging with our trade union side as well as to what that actually looks like. We want to get it right. Rather than rush it, because I like you, I think we need to bring that into place. But it's the time we're running, with a year left in this mandate as well. We've looked at the Scottish model, we're looking at the Welsh model to see what best suits, what can be done. Can we bring in a framework earlier that isn't legislation based, that can actually see those provisions as well? So I don't think there's a relaxed position from our Chief Nursing Officer. I think it'd be quite it's definitely not a relaxed position when she's talking to me. Shall we put it that way? Because Charlotte is very passionate about her workforce as well. But it's also looking at the differential between other legislations and other jurisdictions as well, where I want safe staffing to be about all our staff. And I know all our regions have specifically focused on our nursing staff as well, very important cohort. But I would rather that this provides that holistic approach for all our staff across our health and social care system. For too long, they've been forgotten. For too long, they've been allowed to be the area that took the hit of the cuts from no matter whose budget it was. You know, it was our staff. That's why we had to put in those provisions of an extra 300 training places for 3 years to bring our nursing provision back up to the standard where it should be as well. So the
Minister, you're asking for almost 300 million, and that's 300 million to look after agency staff, which are needed. What I'm saying is we are going to be on this trajectory unless you grip the workforce planning issue properly.
And Carl, I can only do that.
That's not happening.
Carl, I can only do that with recurrent funding, as you know. You know, and the recurrent funding that I got was for safe staff. The only recurrent funding I have in place at this moment in time is the £52 million for the change in salaries for Agenda for Change. Now, the commitment that I have, and it was the commitment that was given from the executive, was additional 300 training places for nurses over 3 years. That only fills the gap. You know, to grip this, and as you say, and you rightly acknowledge, we need those agency staff now because there is such a large shortfall in our recruitment processes. Now, it has increased, our vacancy rate has decreased dramatically since 2017, but it's still staggering, Carl. It's still far too large.
We're 3,000 staff short.
Yeah.
So we're 3,000 staff short. You're handing 90 million back.
I'm not, Carl. Sorry, Carl. Sorry, Carl. I'm not now. No, sorry, Carl. If we go back round that cycle now, it was a 1 year budget. It was COVID relief monies that I got towards the end of the year. I then was able to reallocate, or actually get back to Connor and ask for another 150 million for PPE. So not, you know, I may have handed 90 million pound back on paper, but then I went and asked for another 150. So I'm actually 60 million on the other side of that ask because of what we were able to do with PPE as well. So if I could reallocate that single, you know, those monies that we got towards the end of the year and put more nurses on the ground there and then, I would have, Carl. It's not something we can physically do because it takes time to train those staff.
And in the meantime, what happens to the staff who are beleaguered, exhausted, emotional, feel unappreciated, undervalued because they're on 23 grand a year? Seriously, like?
No, and Carl, those are the pay rates that we inherited. And as you do remember, one of the things the executive did collectively, it was me led the negotiations with our trade union side in regards to getting that pay settlement, that parity with England restored to get those pay rates back up again. And I'll continue to do that because I value the staff that we have in the service, and I think we all do. and I've said this before, I think we undervalued them for so long because people only seen them as being there when they needed them personally. We now see them as a country, as an executive, as an assembly, as to what they actually do, what they actually deliver as well. So let's make sure we get that investment, but it has to be long-term, sustained investment to allow us to make the changes that we need to make.
Okay, just let me interrupt there. There is definitely someone's phone coming through. There's like a tone coming through. Can I ask everyone that's in the meeting to again check that you're on mute at this present time, unless you're speaking. Okay. Okay, Charles, you've very short piece of time there. If you have anything further.
Yeah, in terms of the matter and the ICU. And matter being used for COVID, could it get some? Because there's, like, Michael, you'll appreciate this. I'm in North Belfast and the rumour mill is running rife. So even if it's bad news, I just want some clarity, please.
Michael, do you want to?
Yeah, my understanding is that obviously the priority here has to get complex surgery regionally and. Sorry, Carol, I'm not sure. Are you picking me up okay? Yeah.
Sorry, I missed you at the start, Michael. Sorry.
Yeah, as we discussed earlier, the priority must be to re-establish regional complex surgery, and clearly a lot of that surgery is carried out in the Belfast City Hospital site, which is currently the Nightingale escalated critical care facility. So the priority must be to de-escalate the ICU in the Nightingale facility to then use the regional prioritization of surgery, so we maximise the individuals who are, as we discussed earlier, still waiting for their surgery, red flag surgery. That will then mean for those patients who require COVID, so in other words, creating green sites again, green pathways in the City Hospital and other sites, that will again then mean that we'll have to manage COVID patients requiring complex respiratory care or ICU on other sites. And in the past, that was in the Belfast Trust area, the Mater Hospital. And the plan will be to support those patients on the Mater site, is my understanding, in the short term. And hopefully, as we suppress community transmission of this further, and as we said earlier with the rollout of the vaccine, the pressures related to COVID will become less. And then, we will continue to keep the situation in terms of what services are provided where on what site under continuous review.
So, sorry, Chair, it's my final question. So, Michael, not to miss. Yeah, but you're saying that temporarily the ICU will be opened in the matter to deal with COVID and particularly complex respiratory. Does that mean to say those ICU intensivists will stay after?
Again, I'm not across the detailed plans, Carol, in terms of the operational arrangements that the Trust is currently considering, because obviously those are very complex arrangements. And, I think, as we've said already, I want to put on tribute here my thanks to all of those staff who've relocated, nursing staff, medical staff, support staff, OTs, physios, who are working across sites and have relocated to provide care to very sick patients who are still in our hospitals today and will be for many, many more weeks with COVID.
Carl, can I check? Sorry, Carl, can I just ask, have you had a meeting or do you want a meeting with the Belfast Trust? Would that be?
No, sorry, thanks, Minister. I've organised one.
Okay, right. No,
the Belfast Trust come back to us fairly quickly, so I just want to put that.
That's all right. No, that's all right. No, I thought that would have been useful to you and the facilitator reception.
Okay. Thank you. And going then to Orlia Flynn. Go ahead, Orlia, please.
Thanks, Colin, and thank you, Minister and Dr. McBride. So I'll try and be quick. I'm glad that Jerry raised the GP counselling issue, and Cara also earlier in the meeting touched on the issue of addictions. And I suppose just broadly, I am worried when we're talking about the pathway to recovery, which is a positive and which is full of hope. I do have serious concerns around, Minister, and I know the conversations around the budget, that obviously you have so many priorities. You have a tight budget that you're working with, but in the context of the pathway to recovery and in the context of mental health, I do have serious concerns that we're not going to be in a great place in that respect. And I'll give you some reasons for that. So at the minute, the issue with, we know that the inpatient beds for addictions, there's none at present. I think we only have 30 right across the north. I learned recently that the RAID service, which is the crisis service in the Belfast Trust, that the money has stopped for that. We know that new patients in relation to mental health are being seen later, and they're presenting with much more acute needs. We know that known patients are now also presenting with greater needs, and the number of people detained under the mental health order is now 3 times that amount from the pre-COVID-19 levels. So with all that, and I do appreciate that I know that the 4th meeting took place with the Mental Health and Suicide Prevention Executive Subgroup yesterday, which is great. The 6.5 million was announced for the Emotional Health and Wellbeing Framework, which is great. But Minister, I suppose what I'm really looking to ask yourself today is, can you commit to, in your future budgets, as tight as they are, can you commit to attempt to increase that proportion of the share of the funding, that 5 to 6% for mental health services, commit to increase that in some shape or form? I know that the officials briefed us a couple of weeks ago on the budget, and I asked these same questions, and I know that you have recognised that the mental health services are underfunded and that there is insufficient money. The officials did say that the department is on that journey towards increasing funding, and that they will do a sense check. So I just want to put that to you today to see if I know it is a priority for you, and you have made all the right sort of soundings about that, and I appreciate that. But when it comes to funding and investment, can you give that reassurance today that you will try and increase that percentage funding?
Orly, I can give that commitment. I'll try and do that, because I think you know that it is something that I am passionate about. It's something I want to do. I've been consistent since coming into this post, and we did that. Even during COVID, we kept the work on in regards to the mental health action plan and the mental health strategy, and that's about the 10-year long-term investment in our mental health provision in Northern Ireland. We have the opportunity to make this place a world-class example in regards to how we support people who have mental health challenges, and I think that's where we should be aiming for. But as you rightly indicate, my budget is challenging. What we need to do is complex. It's across a wide range of sessions, but we've seen over the number of years that, again, like power-raised staffing, mental health was at the sharp end of a lot of those cuts in regards to provision to facilities as well. So we've put in additional funding bids in regards to capital and additional borrowings as to how we can even improve our facilities as well, because our bed capacity for mental health provision is something that concerns me, especially as we approach every weekend in regards to where we have spare bed and spare bed provision as well. But it also comes down to the challenge that we have in staffing because of the gaps that we have in our staffing provision, especially in our mental health services as well. So this is about a long-term commitment, a long-term journey, and I think that's what our 10-year plan does. And it's something that we have to focus on. It's something that, and I welcome the executives committee. You mentioned during the meeting of the subgroup yesterday. Again, our 4th meeting, but I don't mean this to be negative or derogatory earlier, but one of the most engaging, thoroughly thought through contributions that I feel all our ministers give. Because around the executive table, our ministers, all of them, get the need to do this and do it right. And it's not just investing in our mental health services as well. It's about how each of the departments contribute. It's about when it comes to addiction services, it's about how we tackle that supply at root source. It's about how the paramilitary task force then has a role to play in actually supporting addiction services because of the supply. The illegal supply is not there. You challenge that as how DAERA interacts by making sure you have wide open spaces. It's infrastructure and communities working together, and on some of our interlink our bridges projects across the West Link and the M2, which all contribute not just to the mental health and well-being of the people in those areas as well, but also as an investment about that early prevention, that people feel better we do a lot of the preventative work, and that's what the investment ought to be about. Unfortunately, now we have to invest in the people who weren't invested in a number of years ago, and that's about how we support them. I'm making sure, and when I had Siobhan O'Neill, mental health champion, was at the briefing yesterday with Michael and myself, and the clear message is, if you need help, ask. And it goes back to that phrase, it's good to talk, it's good to ask. If you need help, please, there is somebody there. There is Lifeline, there are GPs, there are other counselling services out there that can provide a listening ear if that's what people need, but they can also provide a signpost for those who need to know where to go.
Okay, thank you. And then going, Alan Chambers. Go, Alan, for a question, please.
Minister, earlier this week, the Assembly received an Executive Office statement on a roadmap back to post-COVID normality, delivered by the Deputy First Minister in the presence of the First Minister. So it's not unreasonable to assume that this statement represented a corporate and collective agreed executive position. The central theme still seemed to be that we're all in this together. Disappointingly, some of the comments and the questions during that debate appeared to represent a few members of parties in the executive taking a position of perhaps not been happy with the collective position, and subsequent remarks in the media further confirmed that some elected reps are not happy with the democratically collective decision-making process. Does this make the public health messaging more difficult? Second question would be in relation to calls for roadmap dates to be published. I know it's hugely disappointing to be given a date and then find it been pushed back, and it is not as though the various variants are sharing their future plans with us. So can you confirm that the roadmap as published will be subject to constant review and the stages of recovery will not be delayed one day longer than necessary? And the third comment is in relation to comments that Carol made that highlighting the staff pressures at the moment. Could the Minister remind me what party held the health portfolio before he took it over just over a year ago with a pandemic coming down the line, Adam? Thank you.
Thanks, Alan. And in regards to dates, there are the four set review periods, and 4 dates are actually contained in the plan. They tie in with the agreed executive position that we will review our regulations every 4 weeks. It's something we've agreed to do. It's something that is actually in our regulations, that they are formally reviewed every 4 weeks. But we've also made clear as well that if there is the opportunity to review or look at something in between times, we will do that as well. But I think we're on record, the executive is on record as saying that we will only keep these restrictions in place as long as is necessary, and that they are proportionate as to where we see the spread of the virus itself. In regards to who was in this position before, nobody was on the 3 years without a minister. So I come into an empty office. I think that's well documented. But in regards to public health messaging, and again, it's something that I've often said, we need the support of the general public. We need the general public working with us while we get through these next weeks and months, because that's where the opportunity and the hope actually is how we get in and how we get through these next weeks and months with the restrictions that we have in place, but also the opportunity that the vaccine brings. The vaccine will not do all the heavy lifting for us. It's not the panacea for everything. So it's the mixture of people following the guidance, following the restrictions that we have in place, plus the benefit that the vaccine brings. So the message from me, the message from the health department, clearly has always been is to follow the guidance, follow the regulations that are there. Take the vaccine when you can get it. The simple messages still apply. Social distancing, good hand hygiene, good respiratory hygiene. But one thing that we are clear of, and one thing that I'm clear of, is when everyone is given the same message, everybody hears the same message. And that's when we get the response from the people of Northern Ireland. And I will say, Alan, I will say, Chair, I'm thankful for the members of this committee for the support that they have given to my department, to the health service, and to that public health messaging, because it has been consistent. Because this committee having sat and heard some of the testimonies, some of the evidence sessions, are well aware of the effect that this virus is having, not just on our health service, but having on our community. So I think that is why there has been a consistent approach and message from the members of this committee, and I thank you for that.
Thank you.
Okay, thank you. Thank you, and thank you, Minister and Chief Medical Officer, for your attendance today and for addressing members' questions on your presentation. And also just to reiterate our support for the public health messaging, and to ask everyone to continue to do all they can to keep themselves, their families, their community safe. And I do note the badge there that Michael is wearing in relation to the safe distancing and the social distancing. So listen, there's just actually, in terms of the data, Minister, and I know we are all very acutely aware that the data is going to be very important moving forward, and you've touched on it there yourself in the earlier part of the meeting, and particularly around the whole critical care and that element of things. So given that it's going to be so important, could I ask for some specific information to be forwarded on to the committee? So could you commit to sending us on all the minutes and associated papers since August 2020 of the critical care hub meetings? Also the respiratory hub meetings and the oxygen supply meetings. Those are obviously three key areas in terms of moving forward.
I'll take that into consideration, Chair. I'm not giving the commitment until.
Yeah, I don't expect you to have that information to hand. That's why I left it just so just as that's the critical care hub, the respiratory hub, and the oxygen supply meetings.
I'll take it into consideration to see if they can be shared, Chair.
Thank you again, and good luck in the time ahead. Obviously, we're moving into territory now that is difficult, because we do need to negotiate and navigate our way out of this lockdown in a way that's safe and sustainable. And just to wish you and all of your team and all of your frontline staff who are out there still battling, still working harder than many of us will ever understand, perhaps, in difficult in circumstances that many of us will never experience, I hope, and never fully understand either. But thank you again. Okay. Okay, members. Thank you for that. I will take a very short break there, members, maybe just until we get the next session lined up. So could we come back again at 11:05 there, members, please, to resume in public session? So if we could just close broadcasting and resume at 11:05, members. Thank you.
Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly, Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29.
Sorry, Chair, just waiting confirmation. That's us live now, Chair.
Okay, thank you, and thank you, members. We return to our meeting now, and we will go back to the opening items of business, which we had moved to facilitate the Minister's time frame. So we're going, first of all, then to Chairperson's business. I just do want to note, in terms of our Chairperson's business today, a number of us attended last week's all-party group on learning disability, and I think there's a particular call out this week for people who are experiencing or caring for people with learning disabilities to take particular note of the census and to engage with that as fully as possible, because it's crucially important that there's an awareness and a measurement of what services are going to be needed in the time ahead. We're acutely aware that many of those services have been badly interrupted as a result of COVID, but that they weren't great in many cases even pre-COVID. So I just would reiterate that public call to ask people to there are questions added to the census to try to get some more information on that, and I think that'll be something useful for us to do. There were also a number of us who met with fairness in fertility as well, and I think that's an issue that the Minister has acknowledged that is of concern, but that we should be very focused on, given the time constraints around that issue. So just if there are any other members at any of those meetings who want to make a comment in relation to any of those issues.
Chair?
Yeah, go ahead.
Thank you, Chair. I thought the meeting unfortunately didn't last as long as we all would have wanted last night, because I think there's a few members who didn't get an opportunity to speak. So I do think that this is maybe an issue, as we've started to do as a health committee, is maybe just try to have an informal sort of meeting with fairness and fertility and other campaigners, maybe some lunchtime, to get a fuller picture of the whole issues affecting the Regional Fertility Centre and the services.
Yeah, I think that, I'm sure members will agree, that will be an issue of some importance as well. Okay, members, moving on then to the draft minutes. They're this is from the meeting of the 25th of February, which are tab 3.1 of your pack. Are members content with those minutes?
Content.
Yeah. Content. Thank you, members. And there are no matters arising from that. Just before we go into the departmental briefing then on health and social care, if I could ask Clerk there, I did raise an issue at the end that I have was seeking some specific information in relation to a number of work streams that I think are going to be key in terms of data in the time ahead. I can send you the details of those, but it was the critical care meetings, the critical care unit meetings, critical care hub, the respiratory hub, and the oxygen supply meetings. And we're looking for the minutes and associated papers since August 2020 on those. Members content. Thank you. Okay, so moving on, members, then to our second briefing this morning, which is a departmental briefing on the Health and Social Care Bill. This is a briefing from department officials on the principles of the forthcoming bill in relation to the Health and Social Care Board. I refer members to a briefing paper supplied at tab 6.1 of the pack and to a copy of the bill and the explanatory and financial memorandum at tab 6.3 to 6.4. Also included in the table pack there at tab 6.5 is the bill's delegated powers memorandum. So I'd very like to welcome to our meeting this morning, first of all, Ms. Martina Moore. Martina is Director of Organisational Change. Are you able to hear us okay, Martina?
I am, thank you, Chair. Can you hear me?
Yes, hearing you there, Martina. You're very welcome, and thank you for joining our meeting this morning. And we also have, I believe, Mr. John Miller, and John is head of the HSCB Closure Project branch. Are you hearing us okay, John?
I can hear you, Chair. Thank you very much. Can you hear me?
Yes, I'm hearing you there. I'm hearing you fine, thank you. And if I could just remind members of our panel that it is usually clearer if members are using a headset to ask all members to ensure that they're on mute when they're not participating in the meeting, when they're not speaking, and also to ask panel joining us to ensure that your emails and other devices are muted there on your desk to avoid sometimes we can pick up on some of the pinging as emails come into your very busy inboxes. So I would like to then go ahead maybe and invite you, Martina, is it yourself that's leading off in the briefing? Go ahead and provide us with your briefing, please.
Thank you, Chair. And good morning, Chair. And I would first like to start off by thanking you for giving us the opportunity to be here today to brief the committee in respect of the Health and Social Care Bill. And as you said, I'm joined by my colleague, John Miller, who's also manager of the Bill team. So you're provided, as you said, with a short briefing paper, and which I hope you all have found useful in advance of today's pre-introductory briefing. So in terms of the bill itself, the bill is intended to give effect to the closure of the Health and Social Care Board, and in doing so enable the transfer of responsibility of its functions to the department and the transfer of its staff to the Business Services Organisation, BSO.
Sorry, Martina, sorry for cutting across you. It's a little bit. Your sound is not brilliant, Martina. We're catching it. We're following you okay. But maybe if you could just slow down a little. There's a wee bit of interruption. If you have a headset, that'll be great. But even if you just be conscious that there's a wee interruption on the line. Thank you.
Okay. Do you want me to recap just on that first thing? Would that be helpful?
Please do. Yeah, please do.
Okay. So the bill is intended to give effect to the closure of the Health and Social Care Board, and in doing so, enable the transfer of responsibility for its functions to the department and the transfer of its staff to the Business Services Organisation, the BSO. The bill has 7 clauses in total, and in dealing with the dissolution of the organisation is quite technical in its nature. So before handing over to John, who'll give information on the bill itself, I thought, if you may, it would be useful to recap on the decision to close, subsequent consultation, and the operating model to be introduced in closure. As you'll all be aware, the decision to close the Health and Social Care Board was taken back in 2015, and that was a decision that was first announced by the former Minister Hamilton, and that followed the review of commissioning which had been conducted in response to the Donaldson report. That review, which amongst other issues, found the current system to be overly complex and bureaucratic and lacking clarity of decision making and accountability. So that decision to close was subject to a public consultation, and it ran for an 8-week period from December 2015 through to February 2016. We received 181 responses in total to that, and they were from a wide range of stakeholders. That included MLAs, voluntary and community sector, professional bodies, the independent sector and trade unions. And an assessment of those responses gave a clear endorsement of the need for change. And whilst it was acknowledged that change in structures would not be a cure-all for the issues facing our health and social care sector, as part of a broader strategy for transformation, having more effective structures will allow us to better focus our resources and support the system to operate more effectively. Following that consultation, then the decision to close was confirmed when it was also announced by the then Minister that on closure, responsibility for strategic decision making would transfer to the department. And that decision was reaffirmed later that year with the publication of Delivering Together, which is, is our 10-year roadmap for transformation, brought forward by Minister O'Neill as the then Health Minister, and actually featured as one of the 18 initial key actions, and that was Action 9, and that's the need to develop the design of new structures and approaches to support the reform of planning and administration. So if we move forward now to the beginning of last year, Minister Swann endorsed the decision to close the board as the policy position has remained consistent. In terms of that intervening period, work was progressed both in relation to the development of the required primary legislation, which, as you know, is needed to give effect to the closure, but also on the new operating model to be introduced. So if I turn just to the operating model, in line with the previously announced intent, the bill enables transfer of responsibility for the functions of the board and the strategic decision making to the department. And as I said earlier, the staff will then move to the BSO. So that new model will actually see the staff of the board continue to undertake its current functions, albeit they'll be under the direction of the department. They'll be employed by the BSO, but they'll be led by a senior civil servant at a grade 3. And under this model, staff retain their HSC terms and conditions through their employment by BSO, and no staff will be made redundant. And if we go back, I suppose, to that initial decision, it's always been clear that this is about structures and not people. So the board has very many talented people working in it, doing important things. And this approach, while streamlining the structures and reducing the bureaucracy, will provide for continuity of service and thus minimising the risk of delivery to the overall system. And we've established staff-side forum to facilitate our trade union engagement and consultation on this change programme. And that engagement has been of the utmost importance in this process, particularly given the time frame we've been operating in since that initial decision was taken. In terms of the development of the model, we have a project infrastructure in place, and that's bringing across staff from across the department, the board, the BSO, and actually the PHA. And they work together now to progress those activities that will be required to enable the implementation of the model, but also to facilitate improved ways of working, and trade union representation is embedded within that process. And this collaborative approach really promotes that one system ethos that we're seeking to embody across health and social care. So I suppose moving to timelines then, subject to legislative provision, we seek to introduce the model from the 1st of April 2022. With anticipated closure date of the board is 31 March 2022. And as you can imagine, these dates have been chosen specifically to mitigate against a number of potential risks. And that's the complications that you would associate with a closure partway through a financial year, and the double running of systems and the double accounting requirements. So the proposed closure date would minimise any potential issues with governance and accountability. So just before I hand over to John, I'm just going to actually give you some more detail on the bill itself. I suppose I just want to reiterate an earlier point. And that's really the closure of the board will not solve the issues facing our health and social care system, but it's an important step in a wider transformation journey which will look at how we can plan and manage our services differently. It's going to enable us to streamline our structures and processes and better focus our resources and bring certainty to those staff within the board who've been operating, I suppose, since 2015 in that period of relative uncertainty. So if I may, I would like to hand over to John, who will take you through the bill.
Yeah, thank you, Martina. Yes, go ahead, John, please.
Good morning. As Martina stated previously, the briefing document provided to the committee included detail of the structure of the bill, and I would like therefore to provide some additional high-level detail of the content of the bill. Turning to the construct of the bill, it is worth restating the bill's objectives are simply to facilitate the closure of the Health and Social Care Board and transfer its existing functions to the Department of Health or Health and Social Care Trusts. The bill is quite small in terms of the total number of clauses. There are only 7 in total. In terms of the content of each clause and associated schedule, the position is: in Clause 1 simply provides for the dissolution of the Health and Social Care Board. A consequence of this is that its committees, including the local commissioning groups, will also be dissolved. It should be reminded, though, that the department's existing statutory duty to secure the commissioning of health and social care services remains in place. In terms of Clause 2, this clause states that Schedule 1, where the majority of the detail is, contains amendments providing for the transfer of the Health and Social Care Board's functions and amendments made as a consequence of the transfer of those functions. Moving to Schedule 1, it references amendments required in respect of 71 individual acts or orders. I'm sure they will all be the subject of discussion during scrutiny, but for now I intend just to discuss only the main changes delivered by the amendments contained within this schedule. The amendments provide for the closure of the Health and Social Care Board and, as a consequence, the dissolution of its committees. The end of the statutory requirement for the board to prepare and publish a commissioning plan in respect of health and social care for each financial year. As previously stated, the Department of Health's existing duty to secure the commissioning of health and social care services remains in place. Turning to social care and children functions, responsibility for the exercise of children and social care functions will be placed directly on HSC trusts. These functions are already the responsibility of trusts through delegation from the board. This bill makes transparent who is responsible for the social care and children functions following the board's closure. The Department of Health will have responsibility for oversight of the exercise of those social care and children functions by the trusts following the closure of the board. This oversight will be facilitated by a duty being placed on each trust having to provide at least annually details of how they exercise all social care and children functions, and these details will be provided in terms of a scheme. The department will have to approve a trust scheme before it can be put into operation. The department may remove a HSC's trust power or duty to exercise social care and children functions and have them exercised elsewhere. Turning to primary medical services, responsibility for contractual arrangements with and maintenance of providers' lists of GPs, dentists, pharmacists and ophthalmic opticians will transfer to the department. And finally, all other non-social care functions previously delegated by the board to trusts will now be delegated by the department to trusts. Moving to clause 3. This clause places a duty on the Department of Health to make one or more schemes for the transfer of all the assets and liabilities of the board to another relevant health body. The assets include the staff of the board and further details included in Schedule 2. Schedule 2 details what the department may do and must do in developing the content of transfer schemes and its interaction with the board staff in that development. A provision is also made within this schedule to provide for continuity of actions following the closure of the board. For example, anything that was commenced with the board before its closure, including possible legal action in relation to staff or assets and liabilities, becomes the responsibility of the transferee upon closure. That's most likely the department. Moving to clause 4. Clause 4 points to the Schedule 3 of the bill, which contains the transitional provisions necessary to mitigate potential risks arising from the closure of the board. And in that Schedule 3, it provides a duty on the department to produce a final report on accounts on the closure of the board. The final report and accounts are to be shared with the Auditor and Comptroller General, who is also to provide a final report. The final accounts and report of the board and the Auditor and Comptroller General's report are all to be laid with the Assembly. This schedule also includes a number of general transitional provisions to ensure continuity of provisions within the transfer of functions. Finally, the remaining 3 clauses deal with interpretation, commencement date and the short title of the bill. I would now like to turn to the development of the bill. As I mentioned earlier, the bill is quite short and narrow in scope, dealing specifically with the closure of the board. There are no aspects of the proposed legislation that impact on functions of other departments beyond addressing existing references to the Health and Social Care Board in non-health related acts or orders. During the scoping of the legislation, we identified references to the Health and Social Care Board in 24 acts or orders that fall within the responsibility of other Northern Ireland departments. Amendments in respect of these acts or orders all result in the removal of references to the Health and Social Care Board and substitution of a reference to another relevant health body where appropriate. The respective departments are aware and have agreed the relevant legislative amendments in respect of their own departments, and understand those amendments will be progressed through this bill. A further number of Westminster Acts have been identified that include references to the Health and Social Care Board. Again, amendments will result in the removal of references to the board, references to other relevant health boards, reference to other relevant health bodies will be substituted where appropriate. Northern Ireland Office officials have confirmed they agree that the Secretary of State's consent is not required for this bill, and in addition, they have also agreed to take forward amendments in respect of reserved and accepted matters through order in Council should this bill receive royal assent. The Attorney-General provided confirmation that the bill is within the legislative competence of the Assembly on the 2nd of February 2021, and that concludes the high-level view of the provision of the view of the bill. In terms of our legislative timeline, you'll be aware that a series of legislative steps need to be progressed before the end of this mandate if this bill is to be enacted on the 1st of April 2022. It is hoped that the bill will be introduced in the Assembly on the 8th of March 2021, which is next Monday. Speaker's response regarding this matter is expected this week. We're happy to take any questions on matters related to the legislation. Thank you.
Okay, thank you. Thank you, John and Martina. John, just one quick one before I go to a more general one. You said at one point there, I think it was within clause 3, that it would most likely be the department in relation to one issue. I'm just wondering, is that not clarified yet, or why is it most likely rather than specific?
Well, the transfer schemes haven't been developed as yet. And as Martina said at the start, assets and liabilities will be split. The vast majority of assets and liabilities will go to the department. There'll need to be some work around thinking about split in terms of, say, for instance, the example I used was if there was a legal case in terms of staff, would that liability go to BSO or to the department? But those will all be included in the transfer scheme.
Okay, thank you. Okay, well then, I suppose the first question, me, substantive question, is around the new. How will the new structures improve accountability and decision making? And I did note with some concern, just I'd like to tease out. You'd mentioned about the children's functions and placing that duty on the trust, and that the trust would review annually. And I suppose, given this is a transfer and all the inherent possibilities of disruption within that, given the critical nature of care for children, is an annual review enough to kind of capture if something was going wrong? If what would act as the canary in the mine quicker than a year down the line, given the vulnerabilities of some of the children who may be concerned?
Sorry, Chair, if you don't mind, I'll take that one. In terms
yes,
of
absolutely, John.
In terms of the functions themselves, the trusts already have responsibility through a delegation method from the board. Obviously, if the board disappears, they can't be delegated from the board. The decision was made to make this much more transparent and place those responsibilities directly through primary legislation with the board. In terms of the other matters you've alluded to there, performance management will be with the department rather than a board, because the board won't be there with the new arrangements. So the department there will be no middleman, if I want to use that phrase, in terms of those performance management issues going forward. So the department will have sight directly on any performance issues. The schemes are in the legislation as annually. You're probably aware from your previous history that there is a thing called delegated statutory functions at the moment, and that's a report that comes up through the board, through the department annually. So the schemes are a replacement for those delegated statutory functions mechanisms.
Okay, thank you. And then, so that's the kind of the review end of it. In terms of decision making, how do you envisage the new structures as improving decision making?
Sir, can you hear me?
Yeah, I'm hearing you there, Martina. Thank you.
Yeah. In terms of the new structure, I think what we've outlined, in terms of the new structure, what we've outlined then is a model whereby the staff, which were formerly the HSCB, will actually be directed by the department, and they're going to be led by a senior civil servant, grade 3. We have to give that clear strategic decision from the department and that clear line of decision making and accountability to improve on what the rules. So it removes bureaucracy, layers of administration. That's a clear line up. So there's actually the civil servant grade 3 will be actually completely leading that group. So they will direct that, and all decision making will come at the direction of the department.
Okay, thank you. And in terms of, and you had mentioned, Martina, I think transformation, how do you think this can assist in terms of pushing forward the transformation agenda, this particular proposed change? How will that assist with that?
Well, I suppose this proposed change, it does a number of things, and John alluded to that earlier in his presentation. You know, it actually removes some of the provisions that underpin our current commissioning services, like the local commissioning groups and the need to develop a commissioning plan direction. So what we're actually doing now, Chair, is we've commenced a programme of work to look, building on what we've done here in terms of, reducing bureaucracy and streamlining structures. We've actually commenced a programme of work to look at how we can plan and manage our services differently. And what we would like to do is, if we welcome the opportunity to brief the committee on that separately, but that work is now commenced. Now it's going to look at how we can actually plan in a more integrated way. And it's really about a partnership and a collaborative approach based on local needs. So actually, this is a first step in streamlining structures, reducing bureaucracy, but it's an important step that's going to help us lead on to the next. And that work has commenced, like I said, and that's really about, in its first phase, obviously looking at that mechanism for getting local intelligent planning. But local will be at the heart, I suppose, of any new structure, because what we're looking at is something based on the direction of travel that we've set out and delivering together, a move towards collaboration, integration, but very much based on the needs of the local population.
And thank you, Martina. And in relation to that, then, how will the department ensure that there's improved stakeholder involvement in that crucial planning, design, and commissioning of services? How's the department planning to ensure that?
The approach, Chair, that we're looking at the minute is, like I said, it's based on an integrated care model, and that's really about working in partnership, not just across health and social care, but beyond. So it's what's critical in this is working with our partners in voluntary community, local council and all, etc. And in terms of an integrated care approach, it's really, really important from the outset to have those partners in that process. So in terms of that project we've established, we are actually now working with the voluntary community and local councils and how we can actually build the model. Engagement's key to that.
Okay, thank you. Yeah, thank you. And I think that's something that we would be really, really keen to see promoted, expanded, delivered upon, and done on an ongoing basis. So thank you for that. Okay, I'm going to go to members. So at this point in time, I have indications from Carol, Nicolin, Paula, Jonathan, Pam Cameron, and Jerry Carroll. So I'll start off then with Carol. Go ahead, Carol, please.
Thank you, Chair. And thank you, Martina and John. I appreciate that you're coming in to give almost a technical response to the Health and Social Care Bill, but even within that, there's some of the arrangements that the Chair has outlined I would like further clarification on. So, Martina, you said that a grade 3 would take responsibility for accountability. Is that the Permanent Secretary?
No, that's the grade below that. That would be Deputy Secretary level. Deputy
Permanent Secretary. Okay, so
yeah.
So basically, so I can get this right, this is part of the health transformation under Bengoa, which looked at systems and not structures. So the dissolution of the Health and Social Care Bill, some of the functions will be transferred to the trusts and some will be transferred to the department, and that a Deputy Permanent Secretary will take responsibility for accountability on this. So where does the Minister come in? Where does the Minister's intervention come in this?
Well, I suppose it's the department are taking accountability and responsibility for decision making. It's when I talk about the Deputy Secretary, she's going to be leading that group. The way the department is structured at the minute, we have a group structure, each is led by a Deputy Secretary. So this group of staff will become a group that will take those functions on behalf of the department. She will lead and she'll be accountable right through, as you would say, the Permanent Secretary and the Minister. So the accountability is that straight line up through.
So in terms of, say, for example, like commissioning, tendering, procurement. Where does that lie with? Is that with the trust or with the department?
Well, the department, in terms of this new group, will have responsibility for the commission of the services. The department still has responsibility for that. I suppose where we would probably benefit in terms of coming back to is the work that we have started that I mentioned there. We'll actually look at how we can plan and manage services differently in the future. Sorry, can you hear me?
Yeah, I can just about hear you. Sorry.
Sorry. So at the minute, as we transition across, that group of the department will continue to commission the services as needed by the health and social care services. But what I was saying is we have started a piece of work to look at how we can actually plan and manage services differently as a second step of this. So I think it'd be really useful if we come back. That's a separate piece to this to give you a briefing of where we're going to.
Thank you, Martina. We'll see when you do that. Could you also just put on the record some of the clarification that I would need in particular? So say, for example, in relation to, is there going to be a standardised approach to commissioning, tendering and procurement across each trust to ensure that, that it's completely transparent and accountable? And then the other issue is I would like to see a structure literally of what will be transferred to the department, then will go to the trust, and then where the lines of accountability will be. Because we have known this is coming, but what's been lacking here, in my opinion, has been some of the granular detail. So we're going through the stage of passing this bill. While it is technical, we still don't have the detail of what happens in between.
So yeah, I suppose the functions of the board itself, the responsibility for the functions that the board currently undertakes will transfer to the department. So even the responsibility for the social care, what John was talking about, is concerned authority to deliver onto trust, but the responsibility for the functions of the board and its entirety will come across to the departments. We will be responsible for the functions within that. But we'll take your other points and come back on that.
And finally, you did say there would be no staff made redundant as a result of this. So what has the trades unions and the allied health professionals said regarding this bill? I appreciate some time ago you've probably had discussions about that, but I would definitely say there would be certainly a need to have a more recent reassuring conversation, given the fact that we're still 3,000 staff shortages. We are looking at a COVID recovery plan whenever that does come forward. And given this transformation's happening in parallel to all that, we just need that detail.
Yeah. In terms of the union engagement, we've got quite a robust engagement with them and quite a good relationship. So we meet them now every 2 months. And we have that staff side forum where we meet, like I said, every 2 months with them. But what we've actually done is what I mentioned earlier in terms of project infrastructure. So we have a number of work strands that are obviously looking at how this model will be implemented. And that looks things like commissioning social care and children. We've actually got trade union representation embedded within each of those strands. So it's very, very key to this project, and it has been ongoing.
Thank you, Martina.
Okay. Thank you. And going then to Paula Bradshaw. Go ahead, Paula.
Good morning, panel. Thank you very much for coming today, and clearly we've put an awful lot of work into this bill and the preparation reports. So a caveat that in the sense that I've always felt very uneasy about this proposal. I always would have likened the Health and Social Care Board, for example, to the Education Authority, where you would have that layer that would then be the sort of buffer between the department and the actual delivery on the ground, in that instance of schools, in this instance the hospitals. So the Health and Social Care Board themselves would be the appointees who would have the expertise and knowledge to direct the commissioning, as with the EA board. And this whole proposal, not to be dramatic, but screams RQIA mass resignation for me, in the sense that the people who are on the board itself are the ones who bring their understanding of how these processes work. And I just wonder how you're going to ensure that the Department of Health have the same expertise, knowledge and understanding of how commissioning and how health service works, so that it's not just very much fed straight down from the top? Thank you. That's my first question. Thank you.
Yeah, I mean, we absolutely, like you said, value the expertise of the staff and the board, and I think that was one of the things about this model, you know, that we are introducing, that they will be, it's a hosted model because that ensures they retain their HSE terms and conditions, which was very important to the staff. But obviously we need to retain their expertise in this space, and also obviously make the best use of their skills. One of the things, like I said, we are doing in terms of our approach is actually working in partnership across the department and the board in terms of this new operating model and how we can improve our approaches, and like you said, how we can learn from each other going forward. And another key part of this will be the fact that we are taking forward that work on a new way of planning services jointly. So that's a separate project that I'm co-chairing with the head, the director of commission on the board. We're taking it as a joint endeavour and looking at how we can do this differently to make sure, as you said, that there is that read across and there is that learning from each other.
Yeah, I was talking about the public appointments, that sort of board, as opposed to the board, the HS, in the sense of the staff. I'm talking about that accountability, that governance board that are appointed for that reason to give that assurance. But please just make a note of that. I don't want to hog the conversation today, but I am concerned about that issue. The second issue is in relation to BSO, and I know there's an awful lot of people who work extremely hard in there, but my understanding is that the recruitment processes, for example, within that can take 7-8 months, and it almost is like a big grinding wheel that takes forever for things to actually work their way through the system. In what ways will actually the systems and structures within BSO be quickened up? Will they be given extra resources as a result of this change?
At the minute, the way this will work is BSO is very much a hosted model. So as you know, BSO currently provide the HR for the board staff. So in terms of that respect, their operation, they'll continue to supply that. And it'll just be more of agreement then directly with the department rather than with the board. And we are aware, I suppose, of issues in terms of recruitment, as you said, particularly around the length that can sometimes take of that process within. Not just the BSO, but the board, as like I said, is they obviously deliver that. And that's something that we've been looking at over the last while and over the next year in terms of how that process can be quickened up, because those are key positions. And part of the work we're taking forward at the minute with the board is a programme around really building their capacity and capability ahead of this transition. So part of that is identifying where there are those vacancies and making sure that we can move that recruitment process to get them filled. But there is a key focus on the process itself. As you said, it's too long and unwieldy at the minute. And we are working with them in terms of actually trying to put in measures as opposed to speed that up.
Okay, thank you. And the last question is in relation to, I think from my reading of the papers there, is that the local commissioning groups will be done away with. I was actually on the Belfast one when I was a councillor, and one of the benefits from those, as you know, is the ability to respond to the demography of the area that they represent, and also to put in place like pilot projects. Like the Falls project in terms of people's farming. And I'm just wondering to what degree will we still see that sort of quite small projects that are tested in a particular area, but then with the potential to roll out. How will this model actually facilitate that, or is that function being taken away with altogether? Thank you.
No, absolutely not. The local commissioning groups, I suppose, as a construct of the board will disappear, but the concept of that, you said, that local planning and intelligence is absolutely key, and that's part of the work we're taking forward in that separate programme. So what we're actually looking at, like I said, there is an integrated care approach, but it's very much based on local people, local needs, and that's something that we're working through at the minute. And I think, like I said earlier, we can arrange to come and give you a presentation on that work. But absolutely, like you said, those local intelligence, those local groups are actually a key construct of the new model that we're looking to develop at the minute. It's based around local need and partnership.
Okay, thank you very much. Best of luck.
Thank you.
Okay, thank you, Paula, and thank you, Martina. And I'm going then to Jonathan Buckley. Go ahead, Jonathan, please.
Thank you, Chair. Can you hear me? Yes?
Yeah, we can hear you, Jonathan. Thank you.
Okay, thank you, and thanks to the team for the presentation. It is indeed pleasing that this bill is being introduced some years after it was initially introduced by Simon Hamilton as DUP Minister when the initial proposal and consultation went out. So, and I do welcome that, because if implemented effectively, the closure of health and social care boards will allow the department to take firmer strategic control of the health and care system, allowing clear accountability and removing complexity and ensuring decisions are more efficient and responsive. So my line of questioning is very much on the same lines as the Chair's in relation to accountability and responsibility. What structures will there be put in place within the department to manage trust performance, including waiting times as a result of the transfer of commissioning powers from the board to the department? And can this bolster accountability and better outcomes?
Sorry, did you finish the outcomes there? I think there was a bit of a delay on my system. Yeah.
Pardon?
Sorry, I might have picked you up. I'm not sure if I picked you up right there, Jonathan. In terms of what you were saying about performance management, I mean, yes, the department obviously will be taking that strategic control of decision making, and with that, looking at enhanced performance management accountability. And actually, that's another key element of that other piece of work that we're taking forward. It's very much about the department setting the outcomes it expects the system to deliver, and then have that enhanced accountability regime put in place to hold the system to account for that. That's a key element of work that we are taking forward at the minute around performance management.
Okay, I'm finding it hard. It might be my side, I'm not sure, but I'm finding it hard to pick Martina up there, and I don't know if you heard my full question, but okay, I'll move on to another question. Sorry?
The sound is difficult on your end, Martina. I'm not sure if you have access to a headset, but it's a struggle sometimes just to pick up everything that you're saying. Jonathan, is there an element of the question you want to reiterate back to Martina?
No, I think she covered it. I was looking to know how it bolstered accountability and better outcomes. I think that was the end of my question, which I don't know if Martina heard.
Yeah, can you hear me okay?
Yes, I can hear better now.
Yeah. So yeah, absolutely. I suppose what I'm saying is we will obviously have that strategic control, as you mentioned, and we will be looking to bolster performance management. But sorry, I'm not sure if Jonathan's speaking, is he, Chair?
No, he's not. He's not. I suppose the question is really, how will you bolster that performance and monitor?
We are working obviously with the performance management team within the board now, and a key part of that, like I said, is obviously ensuring that we bolster their capacity and capability to deliver within this new regime. One of the things we're also looking at the minute is the setting of outcomes across the system, and really looking at how we can enhance that in terms of what the system to deliver. So where we would set the outcomes at a departmental level that we expect the system to actually deliver across, but we'll then look at how we can enhance, and that's a piece of work we have ongoing, how we can enhance and develop our performance management to make sure that we're holding the system to account for those.
Okay. A notable element of the bill will be the transfer of responsibility for exercise of social care and children functions to the Trust from the Department of Health. What work is ongoing to ensure the lines of accountability in these areas are clear from April next year?
So that's work that's ongoing at the minute within each of these strands. So we have a social care and children work strand set up, and that's for staff from across it, like I said, staff from across department and the board working on that. And they're working through issues like those lines of accountability and the work that needs to be done on both sides to make sure that that performs effectively as we move forward.
Okay, and how will the continuity of service delivery be maintained, particularly with the prospect of longer term reform of social care?
Well, that's key to that, I suppose, is making sure, as we said, that we've maintained continuity by making the best use of the people. So, the people will continue within this. And what we're also looking to do in this space, I suppose, is work with our social care and children colleagues to make sure that when there's a need for any recruitment, that's taken on board and any further development. But we are working across with them to make sure that we can continue that continuity. Continuity is important in all this. What we're also looking to do in this space, I suppose, in terms of any actions being forward, particularly around some of the work that I described earlier is that we're doing so in a way that's cognizant of the pressures also with COVID. We're trying to marry the two up so we can actually make the transformation, but also be appreciative of the pressures that are on the system.
Okay.
It might be my side, but I can't pick anything up. But maybe you are.
It is difficult. If you could slow right down, sort of almost unusually slow, Martina, because there is a difficulty with your sound. So if you can just keep it really as slow as possible, that might help a little.
Sure. Can I confirm? Are you hearing me okay on my side?
I'm hearing you, Jonathan. Yes, okay. And Martina's sound has been a bit patchy, so there is that issue. Have you anything further, Jonathan?
No, happy to move on, Chair. Thank you.
Okay, thank you. Okay, so I'm going then to Pam Cameron. Go ahead, Pam, please.
Thank you, Chair. And I apologise in advance. I couldn't make out an awful lot. I'm sorry, Martina. We're not really getting you at all between delay and bad quality, and it's just very, very difficult to make out. So if you've already answered any of these questions, and I apologise. So many of the functions governed by the Health and Social Care Board relate to achieving safety, quality for patients and service users. For example, the waiting list scrutiny, serious adverse incident reports, complaints, procedures. How will these mechanisms operate after the closure of the board? Could you answer that one first? Thanks.
Yeah, I suppose it's back to that. We would see them as continued job, mainly as they should this minute.
Sorry, Martina, I'll have to cut across you, Martina. Your sound has deteriorated further, and we can't. I'm not hearing anything of the answer now at all. I'm wondering, is it possible for John to answer that question, or is that something that is yourself specifically is aware of? Or I don't know what else we can suggest to improve the sound other than a headset. But certainly, we weren't able to hear any of that answer to Pam.
John, could you?
Yes, I'll attempt to answer that question, and Martina can butt in if I'm going in the wrong direction. The bill is entirely about primary legislation, and the subjects and issues the members discussed are largely covered by regulations, guidance, and procedure. In terms of that guidance and procedure, that won't change, and I think Martina, they won't change immediately. In terms of what Martina said at the start, if I can just re-emphasise, the skills and experience of the board staff won't be lost because they're coming into the department, although they keep their own terms and conditions, to be managed by and directed by a grade 3 director. So in terms of the risk of any kind of loss between the transfer of the function, that's mitigated by those staff coming in with their experience. And going back on a point Jonathan made earlier in terms of social care and children, the staff of the Social Care and Children Directorate are part of those staff that are coming into the department under the direction of the grade 3 senior civil servant, if that helps in any way.
Okay, thank you for that. I'll go on to my next question. It's stated that the board staff will retain their terms and conditions, their health and social care terms and conditions, and that nobody will be made redundant as a result of this bill. That's already been mentioned. Can you tell us how the former board staff will be allocated within BSO?
I don't know where Martina's picking up. Can I ask in terms of clarification of what you mean by allocated?
I suppose distributed, maybe.
The staff will be directed by the senior civil servant in the Department of Health. They will largely do the same duties and have the same responsibilities as they have now. The BSO will be responsible for the terms and conditions of those staff in terms of employment matters, salaries, if there were any kind of normal employment disputes. But other than that, the BSO won't have responsibility or accountability for the functions that they're delivering.
Okay, thank you.
Okay, thank you, Pam. And I'm going then to Jerry Carroll. Jerry, go ahead.
Thanks, Chair. And I struggled to get some of that as well. So apologies for repeating again, but I think we need just a bit more detail on the redeployment of staff. If we can get that in written form, that would be useful. And just on the question around autonomy and commissioning process, I mean, is there scope or what's being sought out in terms of allowing for a more decentralised system? Because I think there's a concern out there that they use the phrase of Martina and John that the HSE board was a bureaucratic system, and there could be a danger of replacing one bureaucratic system with another. So, I mean, what assurances can we get that there's going to be the possibility for trusts to commission services and they're not going to be heavily reliant or stopped or hampered by a centralised system within the department? My questions.
Sorry, it's Martina. Can you hear me?
Just about.
Well, I'll try here, hopefully.
Thanks, it's a bit better.
So what you're explaining is part of this separate piece of work that we're taking forward, and that's really, as I said earlier, it's an integrated care approach, so that's that partnership approach. But what it really looks to do is to empower those local and community providers to plan and manage services based on the needs of their own local population. So it's moving towards that position, but I think a briefing on that project specifically would be really useful for the committee in terms of that work has just started, but I think it would give you a useful sight of where the direction of travel is in terms of that.
Okay, thanks. I got most of that. And I suppose what measures are being considered to kind of avoid specifically an over centralised approach where the department is able to kind of intervene or prevent or sort of stymie, if you will, trusts making certain decisions? To what extent is that being considered? I know it's still being looked at, but at what extent is that being considered so far? Thanks.
Yeah, I suppose in terms of the, like I said, the new system, it's very much about empowering. So it's really much that more, I suppose, about the department taking a step back, setting the outcomes, expect the system to deliver, and then holding the system to account. So actually, it's about those giving that autonomy out to that local areas to build the system to that point. So that's actually the direction of travel that the new system is working towards. But I think, yeah, like I said, I'm more than happy that we arrange a briefing paper for the committee on that. If we wish to see it on that project and work that has started, I think that would be really useful, because I think you need to see probably then where we're going with that. It might help to answer some of the questions you have around this. Sorry.
Yep, thanks.
Okay, Jerry, have you anything further, Jerry?
Oh, sure, thanks. That's me for now. Thanks.
Okay, well, listen, what I would suggest, maybe members, given that there was difficulties with the sound there, maybe if members could forward questions that they didn't feel were answered or they didn't hear clearly enough the answer, maybe those could be forwarded to the clerk, and the clerk could marshal those and put them in to you, Martina, for a response, just so we pick up, because obviously we want the scrutiny and this stage of the scrutiny to be sort of to have that bit of clarity. So if members are content, we'll forward maybe some outstanding questions onto yourself, Martina, or John. Okay.
Yeah, absolutely. My apologies. For the sound.
Yeah. Oh, okay. Okay. Okay, well, listen, I think that's all the indications we have. I'm not seeing any other hands. I'll just check finally with the clerk before we allow the officials to leave. Clerk, is there any other indications at this point?
I've received no further indications, Chair.
Okay. Okay, well listen, I want to thank both Martina and John. Thank you both for your attendance here this morning. And I know this is a first stage of what will be a specific piece of work that we want to drill into in further detail. But for now, I want to thank you for attending our meeting this morning and to wish you all the best in the time ahead.
Thank you.
Okay. Okay, members, thank you. So, members, any additional comments that members want to raise, or anything else that occurs to members who want to discuss prior to moving on? No, I'm not seeing any indications there. Although the only person that I'm seeing Jerry and Pam on my screen at the present time.
Sorry, Chair. Paula here.
Paula,
yes.
Paula, yeah, go ahead, Paula. And I see Carol, so go ahead, Paula, first.
Thank you, Chair. No, I agree with the sound quality wasn't great. I'm just wondering, this is to the clerk, is there any chance that we could actually there was quite a lot of documents there today that are in our committee packs, and it's actually quite difficult to process them in there. Is there any chance we can have those documents sent as PDF attachments in an email so we can properly interrogate them, please?
Yes, not a problem.
Thank you.
Carol?
Yeah, Chair, maybe it's something under AOB. I'm happy to have a look at the questions and send them in. But see, for anyone coming from the committee, I mean, I think, and this has happened a couple of times, and I'm only new to this committee, but especially when they're coming from the Department of Health, if they're in the building, it's really hard to hear them. So they should, I mean, if they could be asked to wear headsets or something, and then this Starlink system, I think, is awful, to be honest. So.
Yeah, no, there does tend to be particular difficulties within the Department of Health. So we will maybe via the clerk maybe see if there's further improvements. I think the headset at a minimum, and maybe if there was a particular room in the building that was more conducive to the sound or whatever, I'm not sure, but I think there does need to be some improvement there. Obviously, it's not good enough that we're not picking up everything in terms of the detail. The detail will be important here, so we'll see if we can create some improvements around that evidence taken. Okay, members, then I'm not seeing any other indications there, so I'm just as outlined then, it is expected that the bill will be introduced next Monday, and second stage will be then shortly after that. At second stage, I would speak on behalf of the committee on the principles of the bill. If the bill then passes second stage, it'll be referred then back to the committee. So are members content with that process and broadly content with that? Yeah. Okay, members. I think I just want to check, clerk. Is the official available on the line if we should happen to need one in relation to the Healthy Start scheme, and then maybe take that item of business and another item or two of business before another break?
Yes, sure. The official is on the line if needed.
Okay, so I'm going to go then to I'll deal with that. Item 7 is SR 2021/26, and it's the Healthy Start Scheme and Daycare Food Scheme Amendment Regulations 2021. And just before I do go into the narrative, clerk, I do have a question myself, so we will want the member, I think, for a short period of time anyway, or the official. So members will remember that this item was deferred from last week's meeting as the Examiner of Statutory Rules was in discussion with officials in relation to the rule. The Examiner has now reported that the SR is in breach of the 21-day rule, but that she is content with the reason for that breach, and she has no other issues to raise. The SR is subject to negative resolution. Can I remind members that this SR makes amendments to provide for the digitisation of the Healthy Start scheme and expands the definition of Healthy Start food to include pulses and canned fruits and vegetables. The committee considered the policy proposal for this SR at its meeting on the 20th of February 2020 and agreed that it was content with the proposed rule. The department has confirmed that there have been no changes to the policy content of the rule since it was considered by the committee at SL1 stage. So we do have Mr. John O'Hagan from the Health Improvement Policy Branch within the Department of Health, and if I could just ask if John can be brought up into the spotlight, please.
Chair, I think John's joining us on audio only. So it is, so we should be there, okay?
Okay.
Yes.
Okay, are you hearing me okay, John?
Yes, I can hear you loud and clear.
Okay, thank you, John. John, I suppose the first question I would have in relation to this is around the process of access to digital, first of all. I represent a rural community, as many of our committee do, and indeed many MLAs do. A rural community here with particular issues with broadband. It's Fermanagh and Omagh Council is recognised as the single worst with Mid-Ulster following in terms of access to broadband. I'm also acutely aware, in terms of my constituency office, of the significant difficulties that people have at times in accessing universal credits, in having to be there to make a call, and the support that is sometimes needed for them, either in terms of technology, in terms of access to internet services and all of that. So is it the case that there will be absolutely no option other than digital, or can you commit that there will be, where needed, that there will be a form available for people to apply for this via paper or via some other method where digital may present particular challenges?
I think initially, whenever this project was in its early stages, colleagues from England who are developing the project did some testing in Northern Ireland with individuals from various parts of the country, and the feedback was that we could or should be able to accommodate the applications online. And that's the way that the project is being progressed. There is a reluctance to sort of move with two application processes and to move away from the paper application.
And how many, you said it was tested, in how many areas and with how many people was that test conducted?
Well, I think it was initially about 20 people from across various areas of the north.
Yeah, and I would suggest that that's quite low. And you know, in terms of rigor and robustness, that wouldn't be a great evidence base. And I can just tell you personally, in my own experience here, where I live in the country area, I can get a reasonable, like maybe sometimes below 1 megabyte or whatever. But the house right next door to me cannot do Zoom meetings as a result. So even within a very, very short area, and that we're both in the same exchange, everything else is equal in that sense. So this can be very, very piecemeal. Is it possible that a review could be built in to ensure that there is no equality issues being kind of that people who are vulnerable and may lose out as a result of this are not being falling outside of the system?
Yes, well. The actual application process will require less broadband input than the likes of video conferencing, etc. You know, it would take no less a broadband input than, you know, a plan for car tax or something along those lines. It wouldn't be the same. It wouldn't have the same impact as the likes of video conferencing, where you would require.
Yeah, well, I understand that. But I understand that. But I understand that, John. But I'm in a constituency here where there are people who literally don't have, who are still using dial-up and things like that. So If someone doesn't, for whatever reason, have access, if someone doesn't have access to online, how are they going to access the scheme?
Yeah, well, I think
what contingencies are in place for those cases?
I think that's something we're going to have to consider as the project rolls out, and it's something I can take up with the project people in across the water and see what the implications are. I imagine that there are areas, in England and Wales where they would have the same difficulties. So they are probably looking at contingencies for that.
Okay.
But
Thank you. So listen,
I can confirm that with them, and I can come back to yourselves as the project evolves.
Okay. I appreciate that commitment, John, because I think it is an important one. We often presume that everyone can access internet somewhere or another, but for a host of reasons, that's not the case. And some of those people may be the most in need of some of these schemes, and the most in need of support.
Yeah.
Okay. Thank you for that. Thank you for that commitment. I'm going to go then to have a few members indicating here. So I have, first of all, Jerry Carroll, then Carol McKillen, and then Pam Cameron. So Jerry, go ahead, please.
Thanks, Chair. Just following off from your question, I mean, I am quite concerned that this hasn't been looked at from the answer we got before. I mean, obviously, it's quite acute in your area and rural areas, Chair, but also we have a situation in urban and cities and towns where people either don't have access to devices or smartphones, and they're unable to get access to online systems, and that obviously was kind of acutely shown through the pandemic around the digital gap and that. So I am concerned that this hasn't been looked at, and I think there needs to be a scheme in place or assurances, or at the very least work done to make sure that people aren't falling through the gaps, because this is obviously an important voucher scheme. It's important for the health of mothers and children, and the worst thing would be to introduce it online and in terms of the digitized process, which may help lots of people, but there could be a high percentage of people who could lose out. So there hasn't been an assessment so far in terms of the percentage of people who may be unable to apply for this scheme if it moves online.
Well, that was part of the initial project work where colleagues from across the water did some initial testing in Northern Ireland, and whilst it was a very low sort of number of people that were involved, the findings were that it wouldn't be an issue, and I think that's maybe particularly because we're sort of aiming this at sort of the younger age group, expectant mothers on people with younger children, and the majority of those would be digitally aware. I would suggest, and I accept that not everyone will have access, but I will sort of take that up with the project people and see what the contingency is for that.
Okay, thank you.
Okay.
Okay, thank you, John and Jerry, and going then to Carol McKillen. Go ahead, Carol.
Thank you, John. I just feel that a sample of 20 people without knowing where the sample came from geographically is far too low. And with respect, John, and this isn't levelled at yourself, colleagues across the water are still getting people who've got their names in Irish, like myself, their names wrong and their children's names wrong, which is causing delays. The system doesn't allow for the language to have FATAs. It holds claims back. So that needs looked at. It wouldn't happen in Wales, but it happens here. So I want that looked at. I also think, to be honest, John, we need an equality impact assessment in this, and I'll tell you why. Because while younger people may be digitally aware, it doesn't mean that they can still afford a device. And I think the independent advice sector here has been invaluable to a lot of people. Our libraries are closed at the minute, and even for people in rural communities who couldn't get access to broadband and may have through their libraries, can't do that because they're closed from COVID restrictions. I just feel this is almost tagging on to what happens across the water, and I feel there's a lot more work still to be done. So I just want to put that on the record, Chair. And also the fact that we're still catching up on the percentage of money. So at the minute it's £3.10 a week to go up to £4.25 in April. Is that the situation just for here? Is that right across the board?
No, that's maintained parity with across the water, not increase.
Okay, thank you. And I'll go then to Pam. Cameron, go ahead, Pam, please.
Thanks, Chair. Could I ask if the legislation governing this scheme, is it domestic or is it contained in the retained EU law? And are there any implications for products provided under the voucher of the Protocol of Trade Disruption East-West?
Oh, you're aware of my remit now. Sorry.
Do you want to come back maybe with the response forward something in?
Yeah. Sorry. Can you just give me that again?
So I was asking if the legislation governing this scheme, is it domestic or is it contained or in the retained EU law?
No, I know it's domestic.
It's domestic.
My understanding, yeah. It's not contained within EU law at all.
Okay. And could you tell me, does the move to digitisation, does it affect retail providers who are participants in the scheme?
The amending legislation removes the requirement for retailers to register for the scheme. So under digitisation, whenever a person actually gets the digital card, that can be presented at more retailers than it could have been in the past. Any retailers that is prepared to accept the card.
Okay. Can you tell us about steps that are being taken to communicate the changes with the businesses?
Yes, that's been done by the project people across the water.
Okay, thank you.
Okay, I'm not seeing any indications then from other members. I'll just check with the clerk if he's aware of any other indications at this point.
No further indications from me, Chair.
Okay, well listen, John, thank you for coming along to our meeting and taking part in our considerations there this morning. And I think there are a number of issues there, obviously, of concern that members would like addressed and looked at. But for now, we can let you go, John, and we'll continue our consideration. Thank you.
Okay, thank you very much.
Okay. Okay, so members, there are a couple of issues of concern there, and I do think there is some obviously commitments to look at some of those issues. It is something. Am I correct in saying, Clerk, that the committee can always look back again at any issue that it chooses to if concerns continue to be raised or concerns are out there, and also as we have in the past, that we can agree the rule to allow the substantive work to continue, but also to note our concerns.
We can advise the department of the issues that have been raised and seek further updates at certain and put timelines in frame for when we're looking updates on that.
Yeah, Yeah. So what would be sort of practical or realistic timeframes that maybe we can that would typically be in a case like this?
It's purely up to the committee on this. Certainly, I would imagine with the system being up and getting started and up and running, you probably want to give it at least a month or two to see how it's going. I think there are some things that we can get responses on pretty quickly, but in relation to review, again, I would probably suggest 2 to 3 months.
Okay. Would members be content? 3 months is 12 weeks, I suppose. Maybe that would be a realistic time for issues to emerge and feed through. Yeah. Carol, go ahead.
Yeah, I mean, sure, I don't think any of us want to hold this back. You know, this is money getting into people's purses and pockets that's needed. But the issue is, like, no disrespect to John, I just felt that was a very shoddy presentation. Not really prepared, and there are really serious questions that need to be asked. So the questions that were raised, I would like them to go into the department for a better response.
Yeah. Yeah, our members agreed that we put those questions in for a response and that we schedule a review around approximately 12 weeks' time to see how this is rolling out on the ground. Would members be content with both those? Okay, thank you, members. So I will then ask formally that the Committee for Health has considered SR 2021/26, the Healthy Start Scheme and Daycare Food Scheme, Amendment Regulations NI 2021, and has no objection to the rule. Are we agreed?
Agreed.
Okay, and that's pending that further information. That's contingent on that further information and us completing a review of that. Okay, thank you. So, members, I'm going to take a short break there before we move on to correspondence. And if members could return back at 12:35, please, we will resume back in session. Can I ask Clerk to bring broadcasting to an end temporarily?
Just waiting on confirmation, Chair.
So
Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29.
That's us live now, Chair.
Thank you, Clerk. Okay, members, thank you for returning, and we'll resume our meeting. So I refer you there, members, to papers at tab 8 of your pack relating to correspondence. And there's two items that I wish to draw attention to members of today. Item 8.7 there is a departmental response to the issues raised during the budget briefing. Do members have any comments to make in relation to that correspondence? No indication to this point. So are members therefore content to note? Yep, content to note. Thank you, members. Item 8.10 is a departmental response to the committee's request for further information on the terms of reference for the public inquiry on urology. Have members any comments they wish to make in relation to that item? No. Okay, members content to, therefore to note? Yeah, thank you. Item 8.18 is a request from Tiny Life to brief the committee. Given the current pressures on the forward work programme, I maybe suggest that a member or members would volunteer to arrange an informal briefing session along the lines of what we've discussed for other groups. Would members be content to note? Would members be content with that approach?
Can I come in on that, Chair?
And is there any members who? Yes, go ahead, Orlea.
Yeah, so I have already held a meeting with Tiny Life, obviously separate to the committee. But I think that it probably would be worthwhile doing that informal session with them. And because I'm conscious with the forward work programme, but even if I could slot them into those speed dating sessions that we're talking about, but I don't know how soon they're going to happen. But I would be concerned that there is an issue with Tiny Life, who provide a really critical service in the neonatal units within the community, that they are having to consider withdrawing their services within Belfast, which is the largest neonatal unit in the north. So there is serious issues there, and I think it might be worthwhile if members are up for doing that additional or informal session with them. Thank you.
Okay, thank you. And what a time to have a bit of background noise coming in from obviously a very small child or baby there somewhere in somebody's background. And Arlene, would you be content, and along with if any other members are content to, would you be content to arrange that on behalf of the committee, facilitate the committee in that respect?
Yes, that's no problem. And sorry, the baby's on my end. It's my newborn nephew.
I don't think there's any. No, I don't think. I think that I don't think anybody's complaining too much about that. It's a nice noise at any time. I have an indication there, so if members are content with that, I'm not sure if Jerry's looking to speak on that. I'll just check. Jerry, is it on that issue?
Sure, it was just a previous item.
Well, just give me 1 second then. So members then are content that arrange that Orlia and another member, if they wish to assist with that, would pull that meeting together. So I'll go to you then, Jerry.
Thanks, Chair. I was just trying to get my hand up before you moved on, but it was 811, the correspondence from the Phoenix Law and the Birth Mothers group, the request to meet the committee. And we had a meeting there 3 weeks ago, I think it was, with some of the campaigners, but I think it would be useful, given next week's session, if we could get a quick meeting with the group before the chair of the working group addresses the committee. So I don't know if that's possible with scheduling, but I would like to suggest that as a possibility, because obviously there's a lot of concerns that the group are raising in regards to an inquiry that they feel need to happen. So I would like to suggest that we have a specific session, even if it is brief, with the group next Thursday before we hear from the chair of the working group.
Well, funny, I had noted the correspondence as well, and I thought it was timely in that sense. It was my sort of view of looking at it, having had that quite a good session with them quite recently, at which they were there. I would have thought in terms of sequencing, it would have been better to get the department briefing and then be able to follow that up with that group to see how that department briefing had. Were there issues that they had with it or whatever? So, but I'm open to discussion. I see Paula indicating.
Thank you, Chair. I do appreciate that everything's now started moving very quickly in terms of the mother and baby home stuff. I suppose if there's not an opportunity through the Health Committee structure, then I suppose I know the Birth Mothers and Children for Justice have been organising some Zoom meetings at night for their members, new and old. So I suppose we could possibly seek to, outside this structure, actually myself, Jerry and anybody else, we could actually probably meet over the next week before that, because I do think that while the event that Judith Gillespie and the department organised was very valuable, I'm not sure we had the opportunity to really drill down in terms of the aspiration of their members. So I'm happy to take that on personally to set a meeting if it can't go through the Health Committee structures.
Okay, yeah, that might be because there is a fair amount of work piling up, but that is important issue. So maybe Jerry and Paulo, if you facilitate that session, members are, as always, able to attend, but at the very least, there will be a report back to the committee, maybe to inform our considerations.
Yeah,
so members agreed and content with that.
Sure, I'm happy to work with Paula.
Yeah,
and then I think if the group still, I think there's probably a desire to get some information, I'm sure, on the record from the group, from the various groups. So maybe if we can take that into consideration and schedule them in maybe in a few weeks' time, if that's possible, I think it would be worthwhile. But I'm happy to work with Paula for next week.
Okay, thank you, members. Moving on then to so in relation to any other items of correspondence, do members have any comments or proposals on any other items of correspondence there before we go to table papers? I haven't dealt with table papers yet. So are members otherwise content then with the actions as proposed on the correspondence memo? Yeah, members content, thank you. Moving on to table correspondence then, the table pack contains a further item of correspondence from the department at tab 8.25 there, which provides the first fortnightly update on the pressures on mental health services due to the pandemic. Members will recall that we asked for this in relation to one of the SRs that was brought forward. Do members have any comments or content that they wish to note in relation to that?
Sure, sorry.
No, not a problem. Yeah. Go ahead, Arlene. Yeah, go ahead.
I'm low on my phone. But it's just to say, I was glad to see that in the table papers, because I know it was something that the team had agreed to provide for us, for the sake of just sort of monitoring how that process is rolling out. So I was just glad to see that, and hopefully we can continue to get those updates, because it's important to know how that's progressing.
Chair?
Yeah. Yes, Paula, go ahead.
Chair, it's my understanding that one of the ladies who's affected by this, I think that they would dispute some of or question some of the content of that letter. So I'm just wondering if we can maybe put this on the agenda to come back to next week when I get a wee bit more information. It was just this morning I was advised that there appeared to be a bit of discrepancy. So I think it's a live issue and we need to keep on top of it.
Okay, will members be content that we reschedule back for a look at that next week again? Yeah. Okay. Thank you. Okay, members, moving on then to the forward work programme, which is at tab 9.1 of your pack there. Are members content to note the forward work programme? Yeah. And I can advise members that at next week's meeting, we're due to get briefed by the department on waiting times. So in order to help members' consideration of that issue, it was, I think, a good idea to speak with the Royal College of Surgeons, who I know have engaged with some of us around their concerns. I think that would be useful to have in advance of the meeting. We could arrange it. We have arranged a session on the Wednesday at 11 a.m. So I would be grateful if you could let the clerk know if you're available to attend that session at 11 a.m. next Wednesday with the Royal College of Surgeons. I think that would help our scrutiny of the briefing to a huge degree. So could members please advise the clerk of their availability? Thank you. Members, any other business then? No. So date, time and place then of our next meeting. Our next meeting will be on Thursday, the 11th of March at 9:30 a.m. via video link. So thank you, members. And can we end the broadcasting session, please, clerk?
This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland